Before this hearing begins, I'd like to pass along some notes about the system we are using today. This hearing will be broadcast live on the House Budget Committee website. Each participant has a control bar at the bottom of their screen that includes a mute button and a video on/off button. The view control buttons in the upper right of your screen control your personal view and can be switched between active speaker and gallery view. This is your individual view and will not affect anyone else or what the public sees during the proceeding. We ask that you please leave your screen in gallery view throughout the hearing so you can see the timer, witnesses, and your fellow members. Please note that the timer is its own square and will only be visible if you are in gallery view. It will remain there throughout the event, and all participants are automatically muted upon entry to the hearing. In a moment, I will mute any participants who have taken themselves off mute. All participants are asked to keep themselves muted when not actively engaging in the discussion, which should help limit echoes or other disruptions. In instances in which members yield back or otherwise conclude their turn speaking, but do not remember to remute themselves, I will do so to limit inadvertent background audio. Members and witnesses are responsible for unmuting themselves anytime they wish to be heard. With that, Chairman Yarmouth, we are ready to begin.
All right, 5, 4, 3, 2, 1. This hearing will come to order. Good afternoon and welcome to the Budget Committee's hearing on the Department of Health and Human Services FY 2023 budget. At the outset, I ask unanimous consent that the chair be authorized to declare recess at any time without objection so ordered. I'll start by going over a few housekeeping matters. We will likely have votes during this hearing and will have to recess briefly. Because our witness has a hard stop time this afternoon, I strongly encourage members to return promptly after votes to ensure they have time to question the witness. Now, the committee is holding a hybrid hearing. Members may participate remotely or in person. For individuals participating remotely, the chair or staff designated by the chair may mute a participant's microphone when the participant is not under recognition for the purpose of eliminating inadvertent background noise. If you are participating remotely and are experiencing connectivity issues, please contact staff immediately so those issues can be resolved. Members participating in the hearing room or on the remote platform are responsible for unmuting themselves when they seek recognition. We are not permitted to unmute members unless they explicitly request assistance. If you are participating remotely and I notice that you have not unmuted yourself, I will ask you if you would like staff to unmute you. If you indicate approval by nodding, staff will unmute your microphone. They will not unmute your microphone under any other circumstances. I would like to remind members participating remotely in this proceeding to keep your camera on at all times, even if you are not under recognition by the chair. Members may not participate in more than one committee proceeding simultaneously. If you are on the remote platform and choose to participate in a different proceeding, please turn your camera off. Finally, we have established an email box for submitting documents before and during committee proceedings, and we have distributed that email address to your staff. Now, I will introduce our witness. This afternoon, we will be hearing from the Honorable Xavier Becerra, Secretary of the Department of Health and Human Services. I now yield myself 5 minutes for an opening statement. Secretary Becerra, I'm not sure if it still feels strange to be on this side of the dais, but it's always great to welcome a friend to our committee. Thank you again for testifying today on the President's proposed 2023 budget for the Department of Health and Human Services. I also want to commend your leadership during what has been an incredibly difficult time for our nation as we continue to battle the COVID pandemic and its impact on American families. When considering this budget proposal, it is important to look back to the beginning of this crisis. To put it bluntly, our public health system was woefully unprepared for COVID-19. Years of irresponsible austerity under the budget caps took a toll on our public health infrastructure and readiness. Former President Trump had gutted key public health agencies and, in an astonishingly short-sighted move, disbanded a White House council charged with pandemic preparedness. Vaccine development was underway, but there was no distribution plan in place. Fast forward 1 year. The American Rescue Plan has now helped us make considerable headway in the fight against COVID-19. It put in place a massive vaccination campaign, invested in state and local public health systems, and lowered healthcare costs for millions of Americans. Thanks to the American Rescue Plan, more than 216 million Americans have now been fully vaccinated against COVID-19. and American families saved an average of $2,400 on their annual health insurance premiums this past year. But we can't wait for the next pandemic or rely on emergency action to ensure our public health systems are up to the task. That is why the Biden budget request for HHS meets the needs of today while strengthening our public health system for decades to come. This starts with an overall discretionary budget funding level of $127 billion for HHS, more than $13 billion over 2022 funding levels, along with major investments in our public health systems and surge capacity so we are prepared for future pandemics and biological threats. The Biden budget increases discretionary CDC funding by 28% and expands no-cost access to vaccines, including a new program to provide all recommended vaccines to uninsured adults for free. This budget proposes the smart, forward-looking investments we need. It invests heavily in research and development, including $5 billion for the newly established ARPA-H initiative to accelerate development of treatments and cures for devastating diseases, including cancer, diabetes, and Alzheimer's. The budget puts us on track to meet President Biden's goal of cutting cancer deaths by 50% over the next 25 years, which would save 300,000 lives and hundreds of billions of dollars annually, and lays out a strategy to reduce HIV infection by 75% over the next 3 years. 2 years of this pandemic have had far-reaching consequences for our society. This budget recognizes that, and it puts forth real resources to address challenges that COVID exposed and exacerbated. It dramatically expands mental health benefits and coverage. It lowers costs for mental health services by requiring private plans to cover mental health benefits and takes steps to address the persistent shortage of behavioral health providers. And it makes historic investments in youth mental health services and suicide prevention. This budget targets systemic health disparities and invests in vulnerable communities that have historically been left behind or ignored. This includes investments to lower America's unacceptably high maternal mortality rate, especially among Black and Native women, and substantial increases in funding for low-income women's health care through the Title X Family Planning Program. And recognizing our obligations to tribal communities, this budget provides $142 billion for Indian health services over the next decade, guaranteeing a stable funding source for IHS going forward. Finally, the Biden budget invests in our nation's children with sizable increases for the Child Care and Development Block Grant Program and Head Start. We've learned a lot from this devastating pandemic, and chief among those lessons is that our public health systems must be adequately funded and fully equipped to combat public health threats before they emerge. We cannot afford the human and economic costs of being unprepared again. This budget ensures that the next time we are hit with a health threat, and we will be, our public health infrastructure is ready to respond. It's also about making major discoveries, which will change the outlook for millions of Americans facing debilitating and life-threatening illnesses. The budget's massive investments in research and development will undoubtedly lead to new treatments and cures. It will save lives. Secretary Becerra, your department has put forth a responsible, compassionate, and forward-looking budget. Thank you again for your leadership and appearing before us today. I look forward to your testimony. And with that, I would like to yield to the ranking member, Mr. Smith, 5 minutes for his opening statement.
Thank you, Mr. Chairman. Welcome, Secretary, back to the Budget Committee. It's good to have you. It's good to have you in person. As the head of HHS, you oversee one of the largest budgets in the entire federal government, annually well over $1 trillion. For 2023, President Biden's budget has proposed giving you a 12% raise to $1.7 trillion over the past 2 years. Congress has also given your department trillions more to fight COVID. Such levels of funding demand a thorough examination of how, when, and where you have chosen to deploy those resources. When the Biden administration came into power, it inherited 2 authorized and incredibly effective vaccines, therapeutics, testing, and a national distribution network. Yet somehow the government seemed to have its worst response yet to the pandemic in 2021. In his first month in office, President Biden shut down Operation Warp Speed, the Trump administration program that had set you all up for success. In March 2021, Democrats passed their $2 trillion American Rescue Plan, claiming it was urgently needed for COVID relief. But less than 9% of those funds went directly to fighting the virus. Dozens of examples of billions of dollars worth of waste as a result of this law have been documented. Taxpayer dollars going to build parking lots, golf courses, luxury apartments, and sports stadiums, among others. Your department diverted $1 billion from a NIH study for long COVID to house illegal immigrants at the border. You then backfilled NIH's funding with money meant for COVID vaccines and testing. Last summer, you rerouted even more money, $2 billion to be exact, this time from the American Rescue Plan to house illegal immigrants. In short, our own government is using taxpayer dollars to prioritize illegal immigrants over its citizens. Over Christmas, we saw a massive testing shortage. Thousands of people stuck freezing in long lines, waiting for tests. It was later revealed during a Senate hearing by officials in your own department that the Biden administration failed to place new testing orders for the first 9 months of 2021. Such failures were not the result of a lack of funding. The American people have given generously and have sacrificed a great deal. These failures point to a lack of leadership and decision-making at the highest levels of the Biden administration. Remarkably, the Biden administration got $2 trillion and ended up less prepared to battle COVID. The funding request in the president's budget comes out to an 11% raise for HHS. That's not including the tens of billions in extra emergency COVID money the White House is currently asking for, but fails to account for it. That same budget cuts border security too. Clearly, the administration has learned nothing over the past year. The sad truth is that the president's budget fails to address the crises his administration has created. In fact, it only makes them worse. Since President Biden took office, there have been more than 2.9 million border encounters, a 426% increase over the previous year. Over 12,000 pounds of fentanyl, enough to kill every man, woman, and child in America, have been seized by Border Patrol. In response, just last week, your department revoked Title 42, knowing full well it will lead to more illegal immigration. The mission of your department is to enhance the health and well-being of all Americans, and yet this budget that you're advocating eliminates protections for the unborn. It rejects the longstanding bipartisan prohibition against federal tax dollars going towards abortions. With credible concerns about COVID-19 originating from the labs in Wuhan, China, the budget does not prohibit funding for viral research in China, nor does it increase oversight on taxpayer-funded research. Reports indicate you allowed teachers' unions to edit CDC guidance that ultimately harmed millions of children by keeping schools closed. There is nothing in this budget that acknowledges or seeks to rectify those mistakes. Everywhere you look in this budget, enshrined are the failed policies that brought us to where we are today. I hope, Secretary, you're ready for some questions, because the American people have a lot of questions and they want answers. Thank you, and I yield back, Mr. Chairman.
Thank the ranking member for his opening remarks. In the interest of time, I ask that any other members who wish to make a statement submit their written statements for the record to the email inbox we established for receiving documents before and during committee proceedings. We've distributed that email address to your staff. I will hold the record open until the end of the day to accommodate those members who may not yet have prepared written statements. Once again, I would like to thank Secretary Becerra for being here this afternoon. The committee has received your written statement, and it will be made part of the formal hearing record. You will have 5 minutes to give your oral remarks, and you may begin when you're ready.
Chairman Yarmouth, Ranking Member Smith, and members, thank you for having me. Thanks for letting me come back to the Budget Committee. Today, more than 255 million Americans have received at least one dose of a COVID-19 vaccine. 2/3 of adults over age 65 have gotten their booster shots. And we've also closed the gap in vaccine rates we usually see for communities often left behind. It has paid dividends to surge resources, including tests and treatments, to our hardest hit and highest risk communities. 325 million free COVID-19 at-home tests shipped out. 270 million free N95 masks made available. From the $186 billion appropriated by Congress for the Provider Relief Fund, 766,000 payments to over 400,000 providers who have received payments for COVID-19 services. That's over 400,000 doctors, hospitals, community health centers, pharmacies, labs, nursing homes, and long-term care facilities, all receiving this critical support. This is real money, real relief, real results. On Monday, I had a chance to meet with Medicare beneficiaries who are now able to purchase their over-the-counter COVID-19 tests with their red, white, and blue Medicare card. Mr. Chairman, this marks the first time that Medicare has covered an over-the-counter test at no cost to beneficiaries. That's a game changer. Beyond COVID-19, today more Americans have insurance for their health care than ever before. That includes a record-breaking 14.5 million Americans who now have secured their health insurance through the Affordable Care Act. That's a big deal. Also this week, the Biden administration is issuing a rule that will fix the health insurance family glitch, which leaves out family members from affordable coverage. Less noticed, but just as important, we launched Operation Allies Welcome, an HHS-led effort that has helped over 68,000 Afghan brothers and sisters resettle as refugees in America. And we're coordinating nearly $300 million in support nationwide for the launch of the 988 National Suicide Prevention Lifeline later in July. HHS has also made key investments to close holes in our public health system in areas like maternal health, where we've extended Medicaid coverage for postpartum care for a new mother and her baby from 2 months to 12 months. The President's 2023 budget lets us build on that record of investment in America's health. It proposes $127 billion in discretionary budget authority and $1.7 trillion in mandatory funding, including a historic investment to transform the mental health infrastructure in our country, a priority I know many of you share. It also asks for $82 billion for the President's pandemic preparedness proposal to get ready for whatever might come next after COVID-19. Considering that COVID has cost this country more than $4.5 trillion in direct support from the federal government so far, this $82 billion investment is a no-brainer to prepare for the next pandemic. The funding we're requesting as well would be end-to-end, which means it would be for research, development, approvals, deployment, and effective response. Budgets represent not just dollars and investments, but our values and our priorities. This budget turns hardship into hope, inclusion into opportunity. And it's a commitment to finish the fight against COVID-19 and build a healthier America. On that note, I want to acknowledge our collective national failure to fund the Indian Health Services at the level needed to meet our constitutional treaty and our trust obligations to tribal nations in America. But even more importantly, the elemental level needed to provide fair and sufficient resources for Indian country. I've seen these shortfalls firsthand in my visits to Indian country. We must be serious about meeting our constitutional and legal obligations to address the health needs of more than 2.7 million patients served by IHS. The President's FY 2023 budget takes a historic first step toward finally delivering on our long overdue commitments to tribal nations. In my written testimony, I detail our proposal to convert the IHS budget to mandatory funding and to bolster it significantly over the next 10 years. This budget is strong and it's a great start, but we must continue to shine a light and hold ourselves accountable on our promises. Mr. Chairman and members of this committee, I look forward to working with you to make the President's 2023 budget a reality and to continue our efforts to give Americans real relief, real results, and real peace of mind. With that, I'm prepared to answer any questions.
Thank you very much, Mr. Secretary. And we'll now begin our question and answer session. As a reminder, members can submit written questions to be answered later in writing. Those questions and responses will be made part of the formal hearing record. Any members who wish to submit questions for the record may do so by sending them electronically to the email inbox we have established within 7 days of the hearing. Let me also say that because of the constraints we have today, a vote series that will interrupt the hearing for probably at least 45 to 50 minutes, I'm going to be very strict with the gavel, and any member who runs their time down to the last 10 seconds and asks a question, I am going to gavel them down and then ask for the response to be made in writing afterwards. That's fair to, I think, fair to the witness, and again, will help us expedite the hearing. So with that, I now yield 5 minutes to the gentleman from Texas, Mr. Doggett.
Thank you very much, and thank you, Mr. Secretary, for your important service. As you know, one of my principal concerns has been price gouging by pharmaceutical companies. I know that you have been here recently to ask the Congress to provide supplemental COVID funding, which is no doubt needed. But I just want to indicate before I vote for it, I want a better idea of what taxpayers have already paid for COVID funding to date, billions of dollars to pharmaceutical manufacturers. And I think it's very important that your administration do more than has been done to date to be transparent about that. The only contracts of those pharmaceutical contracts that have been released to the public have been heavily redacted. It's not sufficient to just stamp them top secret or trade secret to deny access to the public about the pricing and terms of those contracts. And I just hope you will review that with your staff and find a way to make more available to the public generally about what is in these contracts. And going forward, I think it's really important on the contracts that you enter that there be reasonable pricing clauses wherever the taxpayer has funded the research, as happened 100% on Moderna vaccine, so that there is a preserved interest of the taxpayer in the investment that's been made. You know, I don't believe there's been a president in the history of the United States who said more about the damage being done by the pharmaceutical industry than President Trump. Unfortunately, he did next to nothing about it. And it's pretty clear that this Congress still remains under a stranglehold from Big Pharma. If anything is to occur meaningfully to protect American consumers and taxpayers for pharmaceutical price gouging, it will have to come from this administration. There are many things that the administration could do on its own initiative. One small one is to proceed to grant the hearing that is pending now on the price of Xtandi, a prostate cancer drug that was developed with U.S. Army and NIH grants to determine whether it's fairly priced to consumers and what standards should apply. I would just ask you to review that in ways that the administration can be helpful in responding so that at the end of this year, this administration's record is better than the Trump administration's record, and it won't have to do much in order to achieve that objective. A second area you know that I'm very concerned about is the coverage gap. A significant number of people, 2 million in Texas, according to CMS standards, and over 6 million across the country have been left out and left behind because of the failure of states to do their part with Medicaid expansion. I hope you will continue to make that a top priority to close that coverage gap. The provisions that are proposed in Build Back Better concerning adding these people into marketplace plans is a good way to address it. If that can't be achieved, as you know, I have a Cover Now Act that is designed to let cities, hospital districts contract directly, perhaps demonstration projects. We could cover in just 3 cities in Texas half of the people that have been left out and left behind. So I just encourage you to work in all those areas. And finally, one of the areas that I know you are working in already concerns President Biden's pledge to address the suffering that's occurring in our nursing homes across the country. The pandemic has exposed so many deficiencies, poor infection control, little corporate accountability, inadequate staffing, poor working conditions. President Obama had an excellent set of standards that he was proposing that have been dropped over the last 4 years. This is the type of action that family advocates across the country, like Sissy Standards in Austin, have been seeking. Perhaps you could just describe in the minute you have the general direction that you're taking on nursing homes and when you think we might see some reforms.
Congressman, thank you for the question. Good to see you. On nursing homes, we are going to try to work as aggressively and as swiftly as we can to undertake the president's proposals. One of those would be to strengthen the workforce. A second one would be to do much more oversight. We intend to try to make sure that the staffing levels at these nursing homes are adequate so that they meet the needs of the residents who are there. We want to make sure that the monies that we're providing, whether through the Medicare program, Medicaid program, if there are any government dollars that are being provided, that we're getting our money's worth. And the most important thing we can tell you is that with your support, and if you continue to provide us with the resources that we need, we'll be able to do some vigorous oversight. But first and foremost, we have to make sure that those nursing homes are keeping people safe from COVID. We have to make sure that they are providing, they're fully equipped and they're adequately staffed to make sure that they are providing that they're charged.
For emphasis, echoes for emphasis. Gentleman's time has expired. Now recognize the ranking member, Mr. Smith, for 10 minutes.
Thank you, Mr. Chairman. Secretary, Operation Warp Speed under President Trump set the country up for success in its battle against COVID-19 going into 2021. With 2 effective and authorized vaccines, therapeutics, testing, and a national distribution network. Given that, why was the Biden administration's response to COVID in its first year full of so many stumbles, given the tools provided and systems already in place when you all walked in the door?
Congressman, thank you for the question. And I want to take you back to where we were when President Biden took office. Less than 1% of Americans had received a vaccine. And we had a situation where the efforts were not nationally coordinated. And we had to stand up an infrastructure to make sure that we get not just vaccines, but therapeutics out. There was not one single therapeutic that, a medicine that any American could take that would be available orally for that individual. There were, at the time, very few provisions for treatment, the tests that people would need to take. There were no tests available to Americans that they could take at home. And things have changed. As I said in my opening testimony, today, more than 255 million Americans have received a shot in the arm. More than 560 million vaccines have been administered overall, when you count boosts and the rest. And we have now made available hundreds of millions of tests. We have ordered and paid for hundreds, and in most cases, thousands of the therapeutic medicines that some people need who have contracted COVID. Night and day. Today, we are opening up. We've gone through 2 major variants in that 1 year, and both more potent than the original natural virus. And so what we see is that progress has been made, but we're not yet out of the woods.
Thank you, Secretary. One of the big concerns to me is this past year, it appears that it was marked with a lot of chaos on the response front. There were more COVID deaths in 2021 than in 2020. In fact, by 102,882 more to be exact. And this administration started out with the vaccine, at least it was created. That's 128% more in COVID deaths in 2021 than 20. Again, the vaccines were approved whenever you all walked through that door. And conflicting guidance coming from your CDC, masking, no masking, when to open, when not to open, contributed not just to confusion, but undoubtedly to more Americans getting sick or suffering other consequences. You gave yourself $2 trillion in additional so-called COVID relief funding on top of the $4 trillion Congress had already enacted. In retrospect, might it have been a bad decision to dedicate less than 9% of the $2 trillion from the American Rescue Plan to combating COVID-19, particularly given the fact you are now asking for more money to Congress?
Congressman, first, I'd be interested in seeing your math because I don't think it's accurate in terms of how we've deployed the resources that were given to us. We know here at HHS that what we have done with the money that you've made available. First, we say thank you for those who voted for those resources because they've been indispensable, but we have used them to be able to make available those hundreds of millions of vaccines to all Americans. No American is denied a vaccine today. No American has had to pay a penny for those vaccines. We now have the therapeutic medicines that help you stay alive if you do contract COVID.
So, Mr. Secretary, I just want to know, you felt like that there was enough money in the $2 trillion bill, that how much was allocated to HHS in the $2 trillion bill that passed Congress a year ago was sufficient?
Congressman, I will take every penny you all give us, and we will make.
Was it sufficient that was passed of
We
the 2
used,
trillion?
we used every bit of it, and we're beginning to now run out of that gas to keep it going, and we
Thank you,
will need more.
Thank you, Secretary. I will just say we found numerous examples, and my team would be more than happy to show that less than 9% of the $2 trillion actually went towards killing the virus. But the numerous examples that we did find was billions of taxpayer dollars being wasted, planting thousands of trees, building a high-end hotel, a spa, and golf courses, renovating a baseball stadium, new weight rooms, luxury apartments, the list goes on that was in that $2 trillion COVID package. How does spending $2 million of taxpayer dollars on planting trees in Syracuse, New York, help fight COVID?
Congressman, what I can tell you is what we've done with the money that we received and what we did.
Does planting trees in Syracuse, New York help fight COVID?
As I said, I can speak to you what we did with our money, and we made very good use of the money, keeping Americans alive and healthy.
I'll take that as a no. And I also think that sending $1,400 checks to Japanese citizens living in Japan did not help stop COVID. I wonder what that's all about. But there seems to be a lot of decision makers in this administration. We have Gene Sperling as the American Rescue Plan czar. We have Jeff Zients as the COVID response coordinator. It makes me wonder who is ultimately responsible for making decisions on whether it is appropriate for state and local officials to spend $4 million building a new beach parking lot in South Carolina, or $250 million of COVID relief on state parks in Michigan. Where does the buck stop? With you, Mr. Sperling, Mr. Zients, President Biden? Who's making those decisions?
Congressman, if you have any questions about the way HHS has deployed its resources, I'm more than willing to answer those questions. We feel very confident that what we can show is that the American people are receiving real results as a result of the work that was done by HHS employees nationwide.
I appreciate that. Maybe from the prior $2 trillion COVID bill, we shouldn't have used $783 million in stimulus checks to convicted prisoners, including the Boston Marathon bomber. Since I do want to talk about resources that were delegated to the HHS in that spending bill, let's jump to that. Can you tell us how much funding your department has spent over the past year, plus to fly illegal immigrants from the border to various communities across the country?
If you're asking for the last 365 days, that might be more difficult, but I can give you an idea generally of what we have done with some of the money that we've received.
Did you use any of the money in the HHS budget to fly illegals from the southern border to other communities in the country? Yes or no?
We have an obligation, Congressman, to make sure that those migrant children who are unaccompanied by an adult have a safe place to stay while they're temporarily going through their immigration process. We house some of those. Well, we house some of those immigrant children until we're able to find a sponsor, if we're able to find a sponsor, who will house that immigrant while the child is waiting for its
So can you tell me within this budget, show me in this budget where you are planning to use taxpayer dollars to fly illegal immigrants from the border to various communities throughout this country, and how many taxpayer dollars do you estimate you'll spend in the months to come in such flights? Where's it at in the budget?
You can find the information under the the Office of Refugee Resettlement that deals with the unaccompanied migrant children. And what we are obligated to do by law is take possession and custody of a child once they've been placed in the hands of Department of Homeland Security. They are only allowed to keep those children for a short amount of time. We must then take them and we place them in a facility that is able to care for children. Not all of those facilities are there on the border, in American communities along the border. So we do make sure we place them, if we can, in a licensed care facility that is able to care for children.
Also, there's been a lot of conversation about money being transferred, $2 billion, in fact, that was taken from the strategic stockpile and for COVID testing that was used with illegals at the southern border. Where was the the authority to do that?
So I'm not sure where you brought the strategic stockpile in, but what I can tell you is that the COVID monies that we have used, including some of the monies to address the needs of those migrant children, because of COVID, they were not immune from getting COVID, and we would have to do the systems and the processes necessary to make sure that they were tested, make sure that they were not COVID positive, so they would not infect others around them, including the children. And so we did use some of the COVID money made available through Congress to address the COVID-related concerns and services necessary for migrant children.
I see my time's running out in 7 seconds. Secretary, thank you for being here.
Thank you.
Mr. Chairman?
Yes, gentleman from Texas.
The ranking member raises a number of examples that concern me, and I think it would be helpful if you could put the information you were going to give Secretary Becerra into the record so that we can evaluate those, determine if those were decisions made in the huge bill that we approved or by state and local governments using that money or where it was spent. I don't think any but the last you discussed had anything to do with the Secretary of Health and Human Services, but it's something that our committee in our oversight role certainly need to look to see if this money was misspent in any way. So I just ask that you do that.
Gentleman willing to do that?
I am more than happy to submit to the record. Also, I would love for this committee to have an oversight hearing so we could look into how the money was spent. We've sent a request to the chairman, and it would be awesome if we could just not submit it to the record, but actually have a hearing and a discussion of oversight of $2 trillion.
Thank you.
I thank both of you. I now recognize the gentlewoman from Illinois, Ms. Schakowsky, for 5 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Secretary. Always great to see you. I wanted to talk about seniors, no surprise, because I am the chair of the Task Force on Aging and Families, and this has been a priority for me, as you know. So there's nearly 1.3 million seniors and people with disabilities who are living in nursing homes right now, and each one of them deserves a really good quality of life. The pandemic was just terrible, you know. Number one of people who died, people in nursing homes, that, you know, was kind of a death trap situation in many ways. And, you know, public dollars through Medicare and Medicaid make up 70% of long-term care funding. So taxpayers are really paying for these institutions, and yet what we see is private equity firms have gotten more involved. I mean, nursing homes too often, I think, are seen as a way to really make some money, sometimes milking them for the money, and we need to do better. So, Secretary Becerra, we are really grateful to President Biden for the initiative to improve nursing home quality, safety, and oversight, and we really welcome what was said is almost $500 million included for the Centers for Medicaid and Medicare and Medicaid Services, CMS, for that purpose. So what I really want to know, and what keeps me concerned, is whether this is actually going to be enough to address what I think is a really big issue of making sure that we're able to improve care in long-term care facilities.
Congresswoman, first, great to see you again, and thank you for the hug earlier in the hallway.
I wasn't going to mention that, but it was a good hug.
The president made it very clear that we're going to really go in and look deep at nursing homes, because we saw so many Americans die as a result of COVID. That was where we saw the greatest number of Americans dying.
Over 200,000.
Yeah, and unfortunately dying by themselves because they couldn't be joined by their family members. And so we just can't experience that again. So the president has laid out some pretty strong markers. We're going to do more oversight. I mentioned this to Congressman Doggett. We're going to make sure that we find out if these facilities are adequately staffed, if they have people who are adequately trained. The president in his budget does provide resources that makes it possible for us to provide additional relief to about 1.5 million caregivers and families, so we can increase the access because the demand is so great. But we're also going to do something a little differently as well. There are a lot of those folks who are in nursing homes who don't have any choice because families don't have an alternative. Home and community-based services are a great alternative, because if your loved one can be at home where he or she feels the most comfortable, surrounded by loved ones, cared for by loved ones, with some professional help, that's the best way you can go. I say that as a son who had a chance to watch his father pass away in my home, and cared for him and my mother for 4 years while I was living in Sacramento. There is nothing like it, and we're gonna, especially if you pass Build Back Better or some elements of it, we'll be able to make game-changing investments in home and community-based care. And I hope that what you do is realize that Americans are crying out for the ability to care for their loved ones closest to home as possible.
No question about it. And, we also want to think about the workforce and the workers themselves. That's right. And, if you're a home care worker, the average wage that you make is something like $12 an hour around the country. So it's really hard to get people to do that work, even though they want to do that work. So we have to care for the caregivers, both the home caregivers, the family caregivers, and the people who work there too. But so thank you very much. We're gonna, anything we can do to work with you, with our task force, to make sure that home and community-based as well as the facilities can benefit. So thank you.
Thank you.
The gentlewoman's time has expired. I now recognize the gentleman from Wisconsin, Mr. Grothman, for 5 minutes.
Thank you. I'm going to lead off talking about one of my pet topics. I spoke last week with a Dr. Dror from Israel, and he felt, it was a small study, I don't think the sample's enough that you could write home about it, but he found that people who were vitamin D deficient were 14 times more likely to get severe COVID and 11 times more likely to die. I also talked to a Dr. Meltzer from the University of Chicago. I'm not going to quote his numbers, but I think it would be accurate to say that he feels that over half of the COVID deaths could have been prevented with adequate vitamin D. And a guy by the name of, his name is Carl Flieger from Stanford, who may be similar amounts. And I've tried to, in my own little world, publicize it. But when you're talking about a life savings of that amount, it's very frustrating to me that you, and I'll include your predecessor in the group, have done nothing to publicize that. I mean, you can't turn around without running into things about social distancing or masking or vaccinations, enough that everybody has heard these things millions of times over. But the fact that and of course, if you publicized vitamin D more, not everybody would take it, just like not everyone gets a vaccine. But I think you can get a lot of people to take it, and it's apparently good for other health problems other than just the COVID. I mean, you talk about 11 times less likely to die, it's kind of a big number. I wonder, in my district, people are beginning to feel that the reason that the establishment doesn't push it is because you can get a big bottle of vitamin D for $20 at Walgreens, and they'd rather, that there's no money to be made in it, so we don't push it. But could you give me your opinion of vitamin D and say in the future, with all the money you have floating around, may you want to tell about these, publicize it a little bit more for people?
Congressman, thank you for the question. No doubt that vitamin deficiencies lead to a lot of different consequences in the health of so many American people.
11 times more likely to die.
And so what I would say to you is that the health professionals and the scientists at Health and Human Services, whether it's at CDC or FDA, NIH, I know that they are doing some extremely important, some of the most cutting-edge research, and I'm not prepared to give you exactly what they're doing right now on the issue of vitamin D, but I'm certainly willing to follow up with you. But I agree with you to the point that vitamin deficiencies can lead to lots of consequences for folks, and so we know that there are real efforts should be underway to make sure that we're doing the things that are most basic and cost-effective to try to keep people healthy.
Well, I mean, there are so many studies out there. Now, I think the problem they have is all these studies show correlation, not necessarily causation. But when you have things like 11 times more likely, and I can give you these names of these professors from around the country. I mean, the idea that we're 2 years into this pandemic, and I guess even Dr. Fauci, who I have a low opinion of, I guess even he has privately told people how much vitamin D he takes. But for some reason, when he gets on TV, he zips his mouth. And I do feel, and like I said, your predecessor's in the same boat, because I certainly tried to publicize it before Biden was elected. Couldn't get a lot of movement then either. But I want you to look at it and maybe publicize it, and maybe you can cure, save. We could have saved a lot of lives. I mean, I think 300, 400,000 in my opinion. But I talked to you in the Labor Committee with regard to what I felt was too much emphasis on racial groups, that sort of thing by your agency. I'll mention here, maybe you recognize it, new payment model for physicians who implement anti-racism in their care plan. And an implication in some of the monoclonal antibodies distribution that race should come into play. I have the documentation here. Do you feel your office is emphasizing, I mean, to me, a person's a person. I will say, with regard to vitamin D, they could emphasize that dark-skinned people are more likely to be vitamin D deficient. I think I'm the only one who talks about that as well. You could have really saved a lot of lives there. But, yeah, do you feel you're pushing this divisiveness by race a little bit too much in your agency?
I'm going to have to say the gentleman's time has expired.
And Congress, Mr. Chairman, I can answer it's expired,
Okay.
but I would say no, the answer is straightforward, no. We're looking towards equity to make sure no one's excluded.
I thank the Secretary for that quick response. I now recognize the gentleman from Michigan, Mr. Kildee, for 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, it's always good to see you. Thank you. Good to have you back.
Thank you.
And thanks for being here. I was really pleased to see in the proposed budget regarding the Indian Health Service a change that we've been long advocating for. The federal government, as we know, has a trust responsibility to ensure uninterrupted health access for tribal communities. It's something that you and I worked together on when you were here in Congress. Currently, the Indian Health Service is funded differently than other health programs, as you know, like the VA, for example. This unequal treatment means that access to health care is often at risk in the event of a government shutdown. And of course, this is not a hypothetical situation. When the government partially shut down from 2018 to 2019, the staff employed at the Indian Health Service clinics had to work without pay, and important preventive tribal health programs were forced to stop. And that's just not right. As a member of this committee, I've been advocating for some time for parity between IHS and other federal health programs. And I thank the chairman, I obviously thank President Biden and yourself for including this initiative in the annual budget, and I'm committed to working with the administration to get this fixed. And I wonder if you can perhaps address how important permanent funding that is not subject to the whims of congressional action and being suspended by a shutdown could have an impact on tribes that deliver services, tribes like the Saginaw Chippewa tribe that I represent, and particularly if you just might address how this initiative and others might help address care for tribal communities.
Congressman, first, thank you for your leadership on this issue for so long. I think you mentioned it. I think we feel we have a moral obligation to help our veterans. We have a moral obligation to help seniors who have contributed to the Medicare program. We have a moral obligation to our children to make sure that they can grow up healthy, and we provide the CHIP program for them, Medicaid. We not only have a moral obligation to our tribal communities, we have a constitutional obligation. It is in the Constitution And in the treaties that we've signed, we have a trust obligation to do these things, yet we've never done it. And it's high time we do. And it's been as I said, a moral failure on the part of the nation to not recognize it. Perhaps because the Native American population is so small, some people can ignore it, but we shouldn't, because we're talking about the health of human beings, our brothers and sisters. And so I am proud that President Biden is the first president to step forward and say, it's time to recognize not just our moral obligation, but our constitutional and legal obligation to Indian country to do what we should have been doing a long time ago for these tribal nations.
Well, I thank you for that, and I know you worked with and served with my late uncle Dale Kildee, who actually once served as a member of this committee as well, and this was part of his life's work. And so the fact that we're in now a position to see this action taken, I think, is in many ways a testament to his long work in this subject. So I thank you for that.
Amen.
Another subject that I've been working on and spending a great deal of time on has to do with the access to affordable clean water. We all know what took place in my hometown of Flint, Michigan. If it were only just an anomaly and not a warning to the rest of the country, it would be sad enough, but it really is just a warning. The problem that we have, though, is in many of the communities like my hometown, water is really expensive. An average family in Flint pays $864 a year for water. Some people pay into the thousands of dollars a year for drinking water. So I was happy that we were able to work together to form the Low-Income Housing Household Water Assistance Program, secured $1 billion for that effort. The program is making a difference, but it's set to expire at the end of 2023, and water is not going to suddenly become affordable at the end of 2023 in many of those communities. And I wonder if you might just discuss your thoughts on the Low-Income Housing Water Assistance Program, what it means for places like Flint, Saginaw, Bay City, and others, and what the administration hopes to do in extending funding for this really important water assistance program.
Congressman, the president's budget proposes to build on that program because it's so essential. I can point to communities in California where they can't open the tap anymore because water will either not flow or it's too dangerous to drink. And so it's the same whether it's at Flint or in some town in California or throughout the country. No one in America in the 21st century should not be able to open the tap and be able to drink the water. It's incredible in the richest nation in the world that we're talking about this. That's why the president has decided we're going to invest in this and work with you. So I hope that you continue to champion this because it's just the right thing to do. We should be able to take for granted that we're going to have safe drinking water for our kids.
Well, thank you so much, Mr. Secretary. I appreciate those answers. I appreciate your presence here and your great work. And I yield back, Mr. Chairman.
Gentleman's time has expired. I now yield the gentleman from Texas, Dr. Burgess, 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, thanks for being here today. Thanks for being in person. We love virtual hearings, but this is much better. So ARPA H, have you given any thought to where that is going to be located?
Yes, we made the decision under the omnibus bill. We were given some direction on this. ARPA H will be a very autonomous agency. It will have a director that reports directly to the secretary, in this case me. It will be able to use the assets under the auspices of the NIH. It will likely be housed, because it'll be a much smaller entity, it will likely be housed in a separate facility because we want it to be nimble, and it will work under different direction because it will not be constrained by some of the requirements that we see in law for government employees.
So a suggestion for you, I would locate it in the state of Texas if you want it to be nimble. Let me ask you a question. Title 42, we're all hearing about it. The administration says the public health part of Title 42 expires May 23rd. Numbers of people who are likely to enter the state of Texas is already high, and it's likely to be staggeringly high. Are you making any provisions in your budget for preparing people in communities that are going to be the recipients of very large numbers of people who are likely do not speak the language and may be low skilled? Going to put strains on our education systems, going to put strains on our law enforcement, on our hospitals. how are we preparing the communities to withstand that? Since we're not going to protect the border, obviously.
Congressman, first, thank you for the question. There is an interagency process underway, so we can all make sure that we are following through on our obligations. On HHS's end, we're trying to be supportive when it comes to some of the healthcare issues that might be encountered. We also have responsibility, as I mentioned earlier in some questions, for any of the migrants who might come across as minors.
So let me, I'm well aware of that. I've multiple visits to our facilities since 2014. Title 42 enacted March 20th of 2020. The death rate from coronavirus at that point was probably what, 10,000 if that? Is there a public health emergency posed by the rampant importation of fentanyl across our southern border? What is the number one cause of death from people 18 to 48 right now?
What I can tell you is that there is clearly a crisis going on when it comes to drug overdose and drug use. That's why we did change the strategy we have with regard to drug overdose. I will tell you as well that the Title 42 provisions that you mentioned deal with public health in a particular way. It deals mostly in terms of quarantine. It is different from the public health emergency declaration that is based on different law. But in both cases, they're premised on the health of the country and the health of particular communities. They're not based on immigration standards.
Yeah, but here's the problem. The danger to the American people is substantial, and the numbers are going to be staggering. Customs and Border Protection, DHS personnel on the border will be distracted by the large numbers of people that are just simply flooding across the border, leaving open the possibility for the vast importation of drugs, predominantly fentanyl, which is so terribly deadly, and we almost can't keep up with it. It is a true public health emergency. If there were a time to enact or to keep Title 42, it would be because of this fentanyl crisis. And I hope you will look into that. Let me ask you another question. Big bump in NIH funding. Of course, someone who spent his life in healthcare, it's a good thing. But I'm really worried about the development or the possible development of a virus in the Wuhan Institute of Virology. Even Jon Stewart has acknowledged that. Are we continuing to fund things like gain-of-function research in adversarial countries?
Congressman, I think this question has been answered before. The NIH does not fund gain-of-function research in adversarial countries.
But yet it happened. And we need to know why it happened, and it must never happen again.
Congressman, I don't know what you're saying the it is, but we neither funded gain-of-function research at Wuhan or in any adversarial country, and I don't believe the science and the facts are in yet to determine what the source of COVID has been.
Well, I will be happy to provide you the documents from the Dr. Danzig and the work that was done. It's been well documented in the lay press. It's not anything that's classified. I will provide that to you. There's a number of other questions I couldn't get to. I'll be submitting those in writing. Look forward to your responses.
Thank you.
Gentlemen's time has expired. They have called votes now about 6 minutes ago, so we're going to have 2 more 5-minute periods. That'll be Mr. Horsford and Ms. Boebert, and then we will recess through and there are 2 votes, so the series we ought to be able to come back within 25 or 30 minutes after we recess. Now I yield 5 minutes to the gentleman from Nevada, Mr. Horsford.
Thank you, Mr. Chairman. Good to see you, Secretary Becerra. I want to commend the Department of Health and Human Services and our entire healthcare profession. I don't care what administration, we need you to succeed so that we can crush this pandemic, save lives, get our economy back on track, kids back in school safely, and families together. So first, I'm not here to, come up with reasons to beat you up. I do believe there has to be accountability. And the first thing I want to speak to is the COVID-19 pandemic resources. As we learned from the past 2 years, the pandemic can only be addressed when we protect every single person. With an easily transmissible virus like COVID, none of us are truly safe unless everyone, especially those in our most vulnerable communities, has access to test, treatment, and an effective vaccine. Fortunately, HHS was able to do just that through the Health Resources Services Administration's HRSA uninsured program. Unfortunately, my Republican colleagues have demanded that any COVID-19 emergency supplemental be offset by other cuts. So now we are far too late in addressing the current shortfall in emergency funds that our country needs to continue to stem the damage from the pandemic. Now, I sent a letter a few weeks ago regarding HRSA's uninsured program. Sadly, that same week, HRSA announced that they would stop accepting new claims for testing and treatment in the middle of a pandemic. I don't know how that helps communities, small businesses, our economies recover when we're cutting off the very support that is needed. So, Secretary Becerra, would you be able to speak to just how crucial it is for Congress to pass an additional round of COVID relief funds to continue to protect Americans, our businesses, and along with the $82 billion requested in the budget for our public health infrastructure to continue to protect Americans from COVID-19 or any future pandemic?
Congressman, I don't know if I can say it better than you did, but, and I haven't had a chance since I've been hearing all day, but I haven't taken a look at the recent numbers for today for COVID. I get those every day, the reports and the briefings. But we are now at one of the lowest points we've been at for COVID infections, hospitalizations, and deaths. And we're also at a point of running out of the money it takes to keep that fight going to, as you said, crush COVID-19. This is the wrong time. I used an analogy in a committee hearing just earlier today, saying that we're inside the 1 yard line, within the 2-minute warning of the football game, and we need that touchdown to win. And this is not the time to cut off the resources we need to go over the goal line. We know what we need to do. We've been doing it effectively. The economy is opening up. We're all here today, most of us, without masks. This is not the time to have us run out of the funding. And so I urge Congress to provide us with the resources we need, not just to do the provider relief funding for those who provide services to the uninsured, but to continue the therapies, the vaccines, the tests, the masking we need.
And I just want to underscore this. You know, when the prior administration was in, when the prior president came to the Congress with a proposal, many Democrats, including myself, voted for that package. CARES, the family support resources that was passed. And yet now it's like under this administration, in the same middle of the pandemic, we don't have one Republican on the other side who's willing to support the American Rescue Plan or the funding that's needed to crush this virus. I'd like to finish my time talking about Title X. For too long, Title X has been woefully underfunded. There's no reason why someone's income level or their zip code they were born in should prohibit them from being able to access affordable, high-quality, community-oriented family planning or sexual health services. So my question, Secretary, is could you explain some of the adverse consequences of patients foregoing important care because of a lack of adequate funding for Title X, especially in rural areas?
Congressman, I think we all know that there are too many families in America, and COVID pointed this out even more, that don't have access to the care they need. They fall through the holes, the gaps in the system, especially in our rural and inner city poor communities. Family planning services under Title X are a life-saving service that's made available to families which had been cut off for too many, and our president has made a commitment to restore some of that funding and allow those providers to be in the game again. What we're going to do is make sure that if you're seeking family planning services, you can get it from any organization that is qualified and professionally prepared to provide you those family planning services, so we can provide those needs to rural, urban, and suburban families throughout this country.
Gentleman's time has expired. I now recognize the gentlewoman from Colorado, Ms. Boebert, for 5 minutes, and after which we will recess.
Thank you, Mr. Chairman, and thank you, Secretary Becerra. Thank you for being here today. I appreciate you coming before the committee. To start off, as a Secretary of Health and Human Services, can you define for this committee what is a man?
You're looking at one.
Great. So you are a man. I like that. Can you tell me, can men get pregnant?
Unless you know something I don't, I think the answer is pretty obvious.
What is that answer, sir?
I'm asking you, is there something you know that I don't know that would say that a man?
Well, I'm
can become
asking what you know. Can men get pregnant?
pregnant? I'm not aware of it.
Okay. Well, Mr. Secretary, materials coming from your department, you've referred to mothers as birthing persons, replacing that title with
Are mothers not persons?
mothers are persons, but it seems to be more inclusive, like you're trying to include another gender in that.
I'm all about inclusion, Congresswoman.
There you go. Well, just as a mother of 4 boys, I'm not necessarily offended at that. I am a person, but it's just unscientific and absurd
How so?
to include men in that. If you're going to be
person?
inclusive, if you're going to be inclusive in birthing persons, yes.
Well, but it seems to me that you're
Let's
trying
back
to
up.
define the term.
Reclaiming my time. Can men get pregnant? So then we don't need to include them in this. Mothers are mothers. Moving forward, Mr. Secretary, I want to read for you from a document from your office, the Office of Population Affairs. It says in here, and I quote, "Gender-affirming care encompasses many facets of healthcare needs and support. It has been shown to increase positive outcomes for transgender and non-binary children." Mr. Secretary, what is a transgender child?
A child in America is a child in America, and I hope you and I can love that child just as much as
Can
we
you
love our own
define what a
children.
transgender child is?
That's a child in America, and it's an American citizen child who needs the services and love just the way any other child does.
Mr. Secretary, do you believe that a child is capable of making life-altering decisions to maim themselves?
So let me just say to you that I don't agree with your premise, but what I will say to you is children know much about themselves, and with the help of
Do
their...
you believe that children are capable of making the decision to self-mutilate?
Again, I don't necessarily accept the
Well,
premise of your
Mr. Secretary, I
question.
mean, you have gender-affirming care for young people, so this is something that you
I
have
don't
looked
equate
over.
gender-affirming care to mutilation. So if that's where you're going, then you're not going to get the answer you want.
So, Mr. Secretary here, can you tell me if there have been mastectomies, mastectomies, penectomies, or hysterectomies on children?
Well,
And have taxpayers funded that?
so I could probably use the help of my wife, who's an OBGYN, who could talk more, or maybe Dr. Burgess could help us out here.
For gender-affirming care, to be included in that?
I'm sorry, pose the question one more time, please.
In this gender-affirming care, Mr. Secretary, have there been tax dollars put forward to fund mastectomies, penectomies, and hysterectomies for sex reassignment purposes for minors with gender dysphoria?
So Americans are entitled to receive healthcare services. If they are entitled to receive any of the services that you just mentioned, then it would be against the law for us to try to deny them that care.
So for the record, you favor HHS's funding being able for sex reassignment, for surgeries on minors?
I will do everything I can to defend any American, including children, whether or not they fit the categories you have mentioned or not, and if they talk about gender-affirming care, I am there to protect the rights of any American.
Mr. Secretary, I want to turn to a different document. Your office released this gender-affirming care is trauma-informed care. In this document, you clearly state that gender-affirming care includes puberty blockers, hormones, and surgeries for minor children. You go on to assure parents that there is no scientifically sound reason to doubt hormones and surgeries are helpful to minor children. You also discuss this in a document that the potential for removing children from their parents is on the table if they're not providing gender-affirming care. Mr. Secretary, do you think that parents who believe in 2 genders only should have their children removed from them?
Secretary, Mr. Secretary, you can answer or respond in writing. Her time has expired.
I can respond very quickly. Congresswoman, I believe in supporting and protecting transgender youth. I believe that they, along with their parents and their caregivers, will make the best decisions. And I would really urge that politicians like you stay out of their business.
I would urge that children get to stay with their parents, no matter
Gentlewoman's
what
time has
parents they-
expired. The committee
Mr.
will.
Chairman, may I please have unanimous?
No, you can't. No, you may not. We're on a very
to
tight time frame, and there are
enter
votes
this into
being
the
called.
congressional record.
You may, oh, yes,
Thank you, sir.
without objection, you may do that. All right, the committee will be in recess. Please hurry back after the second vote.
Thank you, Mr. Chairman, and thank you, Mr. Secretary, for being with us today. We've heard a lot about inflation, and it's a global problem. There's nothing we've done in America that created inflation in Germany, France, Great Britain, but it's something we have to deal with. It's my understanding that your administration has helped people. Last year, typical family of four got four $1,600 checks, over $5,000 and $1,400 checks, over $5,000 in stimulus checks. Two children would be over $6,000 in child tax credits. The what we usually hear is there's a $3,500 increase in costs. Well, that's over $10,000 that your administration has helped people to pay those additional costs. In addition to earned income tax credits, SNAP benefits, better ACA premiums, extra unemployment compensation, and others. So you're actually helping people do something about inflation. You're also addressing the root causes. Supply, getting things to market will help, and you've made investments in ports, roads, bridges, airports, and rail. Getting things to market. If you can't get them to market, you'll have less supply. The businesses will jack up the prices. You're getting more people to work with investments in childcare. You're more efficient with job training and higher education. So you're actually doing something about it. Others are just sitting on the sidelines complaining like it's going to help them get elected and generating headlines like the one in the New York Times the other day that said Republicans wrongfully accused Biden for higher gas prices. But you're actually doing something, you've already done something about it. Are you doing anything about it going forward to help people with inflation, like helping with drug prices, better jobs, childcare, college prices? Are you continuing to work to help the average family deal with inflation?
Congressman, thank you for the question, and I won't do as good a job as the president can in talking about the things that have happened in his first year in office, but to have created more jobs in 1 year than any president in his first year in office in history is a remarkable achievement in the face of a pandemic. When you take a look at the fact that we reduced child poverty in ways never seen before in our lifetime because of the work that you all did in passing the American Rescue Plan, the fact that there are more Americans insured for health care today than ever before, and many of them through the Affordable Care Act, is a testament to the work that the president's doing. We are reducing the cost of that health insurance policy for Americans. We are going to try to do everything we can to make sure that on Medicare we continue to reduce the cost that seniors pay for prescription drugs. I could go on, and the fact that today Americans are going back to work and we're able to return mostly to normal, and if we continue to be cautious, we should be able to defeat COVID if you all give us the resources to do this. Those are all pointing in the right direction.
Thank you. And you're doing it in a fiscally responsible way. You know, of course, that every Democratic administration since Kennedy has left office with a better deficit situation than they inherited, without exception. And every Republican administration has left office with a worse deficit situation than they inherited, without exception. And President Trump was well on his way to fulfill that trend before the pandemic. A few days ago, the OMB director told us that we can expect the Biden administration, with your budget, to improve the deficit. So within that fiscally responsible budget, can you say what you've got in the budget for Head Start, particularly for Head Start and early Head Start?
We are increasing the resources for Head Start. With Build Back Better, if you all can get it across the finish line, we would do a dramatic, it would make a dramatic difference in being able to increase the number of kids and families that could qualify to have their kids go to Head Start. And as you and I know, having kids, giving them the opportunity to learn before they start kindergarten sets them on a path to real growth and opportunity when they go on to college.
Child care is so important. What do you have in the budget to improve access to child care?
Well, on top of the several $1 billion that the American Rescue Plan made available to help so many families that were urgently in need of help when COVID was really hitting us hard, we are proposing, and we hope through the Build Back Better agenda, that we would be able to not only increase the number of families that would receive child care services, but that they wouldn't have to pay more than 7% of their income for those child care services. And we hope we would also be able to then push to make sure that the workforce within the child care services sector would be able to see an increase in their salary, and with it, an increase in their training and education.
Thank you, Mr. Chairman.
Gentleman's time has expired, and now recognize the gentleman from Ohio, Mr. Carey, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Secretary.
Of course.
Given the mounting evidence about the origins of COVID-19 and that the People's Republic of China has been clearly involved in covering up, or at the very least brazenly withholding information about the pandemic's beginning, does the President's budget provide for or allow for funding, particularly NIH grant funding or viral research for the People's Republic of China?
The President's budget includes no dollars for China to do viral research, has not and will not.
So you can guarantee that any HHS funding requested in the FY23 budget will not go either directly or indirectly to the People's Republic of China?
I can guarantee you that the federal government, this administration, and HHS, whether it's NIH or any other agency that might have granting authority, is not looking to give any money to the People's Republic of China.
Thank you. Your budget also proposes more than $750 million for health equity programs and climate research, among other things, while reducing funding for the rural hospital grants in my district and Children's Hospital graduate medical education. How does HHS justify prioritizing the progressive wish list of items over investments in rural health and children's hospitals?
Congressman, I'd love you to show me the numbers, because what I know is contrary to what you just said. We're actually making more investments in rural America when it comes to health care. We're actually increasing the number of health professionals that we'll be able to locate in rural facilities throughout the country. And so I'd be interested in seeing where you're getting this information, because it is, as far as I know, misinformation.
I'd be happy to have your staff work with my staff to get that information.
Look forward to that.
Lastly, I think there's a couple other things I would like to mention. The budget also mentions support for rural hospitals, as you have indicated, and providers, yet doesn't provide any substantial funding for rural health, is my numbers, so we'll work with you on that.
Please.
In fact, only $43 million above FY22, and in fact decreases the funding for the rural hospital flexibility grants by $5 million. By contrast, the same sub-agency, Health Resources and Service Administration, dedicates $5 million in new funding for grants to address and implement bias on healthcare providers. $1 million in new funding to the National Academy of Medicine to study biases recognition and clinical skills testing in certain medical schools, $20 million in new funding for diversity workforce, $25 million in new funding to diversity of the nurse workforce, and $10 million to support curricula developed in minority-serving institutions. How does HHS justify prioritizing millions more in radical bias training and workforce diversification than investments in rural health? And you're saying that it does, so I'd be happy to hear your answer on that, and I'd be happy to your team work with my team to get those answers.
First, thank you for letting me answer. Again, we don't have to necessarily agree, but I appreciate that you let me answer. One very important clarification, as I mentioned before to some other questions that were asked. The budget that we presented was based on what we saw coming forward under the continuing resolution, which you know is at a different funding level, much lower than the omnibus, which was the end result for the budget. Because we had to be fiscally responsible and base our 2023 projections on what we had from 2022, and those were based on the CR, we lowered all of our projections. That's why you might see some areas of funding that seem lower. We are absolutely prepared to work with you and others to make sure that we now that we know what the omnibus provided us, give you the true reflection of what we'd like to invest in those areas. But I will tell you that we are making major investments in rural America when it comes to healthcare. On the issue of equity and diversity, we're simply trying to do what I would hope you would want us to do. If you found that the federal government were letting out grants and resources to every place but your congressional district, you probably would be interested in finding out why. Well, there are many communities in America that are being left out all the time, whether it's in research trials where you don't find every American has a chance to participate, which skews the results of those research trials because we're only looking at a particular segment of America and hoping to apply that throughout the country. What I would say to you is, you've been gracious to let me answer. I'm more than willing to work with you to show you that not only do these programs work to provide every American with opportunity, but in rural America, we're making major investments.
Thank you, Secretary. Thank you, Chairman. I yield back.
Gentleman yields back. I now yield 5 minutes to the gentleman from New York, Mr. Higgins.
Thank you, Mr. Chairman, and Secretary, welcome. Great to see you again. And so your budget, Health and Human Services, is about $1.9 trillion proposed. 27% increase. Justification is, among other things, pandemic preparedness. We just went through 24 months of a very difficult time with SARS-CoV-2 because for many, many months there was no vaccine. I mean, really the best thing that our healthcare system could do is provide people that were stuck with COVID-19 with Tylenol to reduce fever and pain. And then, a pretty miraculous biomedical achievement in the messenger RNA was established. Not a new technology, but certainly refined for this. And when medical researchers went into it, the anticipation, the hope, was that they would be able to achieve 60, 65%, maybe 70% efficacy. These vaccines are 85, 90, 95% effective. The thing that concerns me is that if there was if we just went through SARS-CoV-2, there was a SARS-CoV-1 17 years ago, with 70% of the genetic similarity to that of SARS-CoV-2. Predating this administration and going back 17 years, why weren't we better prepared in terms of pandemic preparedness, given that we had experienced SARS-CoV-1 when COVID-19 hit?
Congressman, first, good to see you, and let me try to give an answer. I'm not going to pretend that I know what was going on in the minds of HHS administration 17 years ago, but what I will tell you is that we've been learning more and more as we go through each of these episodes, and it is unfortunate that the previous administration decided to stand down on pandemic preparedness when they dismantled the very organization that was set up to prepare us for pandemics. They did that right before COVID hit. What I will tell you is that our scientists and our healthcare medical professionals have learned a great deal about some of these viruses. And they believe that they're getting very close to having a SARS type of vaccine that could be effective against any future viruses that are of the COVID source. What I will tell you is that science relies on the public and private sector working together, and for the federal government to be making the investments early and upfront that give our scientific community and our private sector community the confidence to know that if they too really invest big sums of money into this, they'll bear fruit. And that's what we have to continue forward. That's why the president has in his proposal, budget proposal, an $82 billion plan to go to what comes next after COVID.
The Advanced Research Projects Agency Healthcare includes $5 billion, the president's Moonshot Initiative, which is a very, very welcome sign. But I also see that in addition to that net new money for that program, there's a $200 million cut to the National Cancer Institute. And I would just ask that the administration take a look at that, and perhaps Congress can make a change to that to boost the amount of funding to the National Cancer Institute. Because I often say that the only failure in cancer research is when you quit, or you're forced to quit because of lack of funding. And we're at a point in terms of developing new therapies, particularly immunotherapy, where these are major game changers in a 50-year federal effort to cut cancer and cancer deaths, which is very important. Then finally, the Provider Relief Fund, Phase 4 applications were allowed between December and May. I have the only public hospital in my district, the Erie County Medical Center, and I just ask you to look at reviewing and expediting their Phase 4 Provider Relief Fund allocation, because as you know, hospitals have taken a major hit during this pandemic. So congratulations on the wonderful job that you've done and the job that your Health and Human Services has done in the past year. Much appreciated.
Gentleman's time has expired. I now recognize the gentleman from Florida, Mr. Donalds, for 5 minutes.
Thank you, Mr. Chairman. Mr. Secretary, thanks for coming in. Let's hop to it. Got a lot of stuff. Back in February of 2021, how many children did your department take possession of from Homeland Security because of the surge of illegal immigrants at the border under the Biden administration?
Congressman, I don't have that number before me, but I can get that to you.
All right, so let me ask you the second question. In response to what was happening at the border back in February 2021, it was the position of your agency, your department, to go through the process of setting up 10 facilities at Fort Bliss and other facilities across the country. How many facilities does HHS currently have in operation that houses illegal immigrant children in the United States?
So, Congressman, right now we have a number of the unaccompanied migrant children who are applying for asylum and therefore have a basis under our laws to be here while they go through their process. We have a number of facilities. There are scores of facilities that are what we call licensed care facilities that have the license in the state where they are residing to offer care. There are scores of them throughout the country that we use. Most of the care there.
How many? So I've seen some of your facilities. I've toured a couple of them. Unbeknownst to staff, I just kind of showed up. You know, that's the purview you kind of have.
Are they the licensed care or are they the emergency?
No, these were the facilities at Fort Bliss. When they were still setting up Fort Bliss, I walked on the base and saw some of the facilities.
Right.
I also saw, if you're in that section, that it appears to me that HHS actually has contracts with various hotels throughout the United States that would house young migrant children in hotel facilities, where it seems like HHS would contract for the hotels and they would cover up the marquee, and we were housing young children. Do you happen to know how many hotels that HHS currently has under contract holding migrant children?
There are no hotels under contract.
Not anymore?
There are no kids in hotels.
You sure about that?
Unless you know something I don't.
I've seen the facilities. You sure?
You name me a hotel.
Okay, well, the marquee is covered up, sir, under contract for HHS. Let's
more
move
than
on. In the facilities that you have where you hold children, how many nurses has HHS contracted with to actually provide health care to children who were being housed by HHS? And how many of these nurses have been relocated from hospitals throughout the pandemic where they could have worked in our hospitals with respect to COVID-19, but they were actually being contracted with by HHS?
Okay, Congressman, you're convoluting different things into one.
That's not a convolution.
Yes, you are.
If you contract with nurses, and I have hospitals in my district that can't find nurses because they're losing contracted nurses to Texas or Arizona, that's not a conflict. That's not a conflict. There's a pool of people who have an ability to work. So how many nurses have been contracted with by HHS?
So, Congressman, again, you have to distinguish between the licensed care facilities and the emergency intake sites that we operate.
In the emergency intake sites, how many nurses has HHS contracted?
I can try to get you any numbers we have, but because they are emergency intake sites, and this is important, we don't provide the same level of services that you get in a licensed care facility. By being a licensed care facility, they have some of those licensed professionals there providing services.
How many licensed care facilities does HHS currently have dealing with the illegal immigrant issue caused by the Biden administration?
I want to make sure I don't misspeak, but it is at least dozens, if not hundreds.
Okay, question. How many teachers currently are contracted with by HHS? Because in one of the facilities, there was actually education being going on, and there is a contract associated with that. How many teachers are contracted?
Again, are you speaking licensed care facilities?
These are the emergency care facilities.
I'd have to get you that number because, again, we're not obligated to provide educational services at these emergency intake sites.
Okay, real quick. I know sometimes these hearings, it seems like we're going back and forth, but that's because we have a limited amount of time, a lot to get to. Quick question. When I was at one of the Border Patrol facilities, I believe it was down by Fort Bliss, El Paso section, there are buses and there are motor coaches that were coming and picking up children 15 at a time, 20 at a time, 30 at a time. How many buses has HHS contracted to move illegal immigrant children across the United States away from holding facilities by the Department of Homeland Security?
So Congressman, I would ask you to make sure that your reference is accurate. These kids have requested asylum, whether or not
It's
they
regardless of their asylum question is how much has HHS contracted with to move children across the United States?
But their presence here is not as you categorize it, because they have requested asylum, and therefore it is an unfair characterization.
Did
And
they request,
ultimately
did they
have to leave
request
the country.
asylum at the southern border at an illegal point of entry, yes or no? Is the southern border an illegal point of entry for immigration purposes, yes or no?
When you are requesting asylum, you are conveying that you are trying to escape persecution.
All right, real quick, 15 seconds. Last question, Mr. Secretary. Title 42 is about to be undone by the administration. Does your budget account for a surge of new migrants, illegal immigrants, however you want to phrase it, that are going to come to the southern border and request asylum under the most broad interpretation of asylum in American history? Is HHS prepared in the current budget to deal with the massive increase of people that are going to come to the United States, including illegal immigrant children?
We appreciate the work that Congress has done to provide us resources to try to provide the legally obligated services for these unaccompanied migrant children. We're going to do the best we can with the resources that we have.
Gentleman's time has expired. I now recognize the gentlewoman from the Virgin Islands, Ms. Plaskett, for 5 minutes.
Thank you very much, Mr. Chairman, for holding this hearing. I want to thank you, Mr. Secretary, for your patience and for your service in the Biden administration. I want to personally thank you for your leadership when you were a colleague here and all of the advice and support you gave me as a new member coming to work for the people of America. So thank you, and I know that your staff are incredibly happy to work with you. Wanted to ask you some questions that were specifically related to Medicaid. What is the level of federal Medicaid funding for the territories? And does the president's budget include throughout this budget window? Are you aware of what that would be?
I can tell you because whether I was as a colleague or now as a Secretary of Health and Human Services, we do not adequately provide resources to the territories, and the president has made it one of his goals to try to change that. So working with Congress, because we do need statutory authority, we hope to be able to do that.
And that statutory authority is the request that you have for Congress to do that.
We have requested, and we've supported eliminating Medicaid funding caps for the territories.
Thank you. That, of course, would be incredibly important. The Congress has, since 2017, after the hurricanes hit, and I know Chairman Pallone as well has worked tirelessly to bring this up. In the Virgin Islands alone, just leveling the FMAP number and making it more equitable with the states based on population has allowed us in the Virgin Islands to increase the amount of individuals by over 20,000. That has really been a game changer for our hospitals and for others. So I thank you for that and your desire to support us. HHS funds the Welfare Rules Database maintained at the Urban Institute to capture the rules regarding determining eligibility and benefits for TANF assistance. It does so for 50 states and the District of Columbia, but doesn't include the Virgin Islands, Puerto Rico, and Guam. Additionally, supplemental security income is not available to the Virgin Islands, Puerto Rico, and Guam, and these jurisdictions operate public assistance programs instead for the populations aided by SSI elsewhere. Has HHS considered expanding the Welfare Rules Database to those other territories so that eligibility and benefits rules are available for those jurisdictions as well as the 50 states and the District of Columbia?
You're pointing out, Congresswoman, longstanding disparities that exist for the territories. And you have my commitment to make sure we can try to work towards eliminating those. We probably need your help in changing some of the statutory provisions that make it difficult for us to get there. But we are actually committed to working with you to try to get there.
Thank you. On July 26, 2021, I sent a letter on behalf of the Congressional Black Caucus as co-led with my colleague, Congresswoman Robin Kelly, who's been tireless in this as the chair of the CBC Health Brain Trust. It was signed by 38 members of our caucus. The letter specifically requested that your department would work to ensure meaningful access to the potentially curative sickle cell disease therapies on day one of their approval by the FDA. We received a response from you, thank you, on November 1st of 2021. I'd like to ask where the department, with respect to convening a multi-stakeholder dialogue about identifying and providing solutions to help remove barriers that stand between sickle cell patients and those potentially curative therapies.
Congresswoman, we are doing more than had been done previously, but let me suggest to you, in fact, let me make the invitation right now. This is one of those areas where I've spoken to our team, and we've spoken to a lot of the outside advocates on this. I think under this administration, we could move to actually help all Americans who suffer from sickle cells get past the pain that they constantly suffer. We have learned so much, and with the technology that we have today, there is no reason why we couldn't target sickle cell. And so, having done a meeting at NIH on this particular issue, I think that we are prepared to tell you that if you're interested, we'd like to join with you, because if we get the resources, we could really blow this one out of the water.
Well, thank you for that. This has been a disease that has really just been pain managed by government as well as our researchers. And we recognize now through some incredible work that this may be a disease that we can cure. It would be just phenomenally changing. I've lost a number of family members to the disease, and I think it's something that we can get through.
And what's really traumatic is that oftentimes people come into a caregiver and saying they're in such pain, but they're not believed. People don't, and it's not until they find out that they have sickle cell that they realize, okay, you must be undergoing severe pain. But it's the difficulty of people presenting with pain and not being believed. That's what's really hard to believe.
Thank you so much, and I yield back.
Gentleman's time has expired. I now recognize the gentleman from Pennsylvania, Mr. Smucker, for 5 minutes.
Thank you, Mr. Chairman. Good to see you, Secretary. I have two issues I'd like to bring up. One is specific to my state, at least I'm aware of it only in my state. I've been troubled by efforts underway in the state led by Governor Wolf through Medicaid officials at the Pennsylvania Department of Human Services. And I support the right. I have hospitals in my area and providers that some are members of collecting are unionized and others are not. And I certainly support the right of workers to unionize. But for the first time, there would be provisions in the Medicaid program that would force collective bargaining and essentially force unionization on physicians, hospitals, nursing homes, and other health facilities, again, through really unprecedented and I think unlawful contractual requirements for providers that are participating in the Medicaid managed care program, which we call Health Choices. And I think the outcome would potentially be it'll deny health care access for over 250,000 Medicaid beneficiaries across the Commonwealth, or force them to travel longer distances to receive needed care. And as you know, CMS will have the ultimate say on whether to accept these contracts and accept them if they would with, I think, these burdensome, politicized, and unnecessary unionization requirements. And more importantly, I think CMS also will have the opportunity on the other side, other hand, to protect access to care for Medicaid beneficiaries across Pennsylvania by blocking these specific contract provisions. So I ask you to look at those when they come across. I have three questions for you, just yes or no. Would you agree that regardless of how one feels about unionization, working families, women and children who rely on the Medicaid program should never be used as pawns in workplace organizing advocacy, and that state Medicaid officials should never attempt to hijack health care from poor and vulnerable beneficiaries in an effort to force a political outcome? Would you? Yes or no?
I think you know that I'm going to say that's a question that doesn't that calls for more than just a yes or no, because you planted so many little time bombs in it. What I will tell you is that the objective of Medicaid is to expand services, and so we'll do everything we can to make sure that we're increasing the number of Americans who have access to good quality health care.
Do you feel that Medicaid managed care contracts are the appropriate forum for a governor or for CMS to push partisan labor priorities?
I've got enough jurisdiction as it is. I'm not going to take on the role of governors and tell you what they should or shouldn't do.
Well, I thank you for that, but you will be, CMS, maybe not you personally, but will be approving these contracts. So,
But based on the issue of whether it's
Yeah.
increasing access to care at a better price.
so maybe could I just get at least a commitment to closely examine these provisions, which again, I think are unlawful, that I think will deny care to Pennsylvanians?
Absolutely.
And will you work with my office to ensure that uninterrupted, seamless access to care remains available for Pennsylvania's Medicaid population? Thank you. Now, just briefly, looking at the clock, discussing the president's budget, it includes $73 million in new spending, $16 trillion in new debt over the next 10 years, and really doesn't address sort of the drivers of cost in the Medicare program. The Medicare Hospital Insurance Trust Fund Part A is projected to face insolvency by 2026, only a few short years away, at which point it will only be able to pay for 91% of Part A scheduled benefits, cutting $44 billion that year's current projections. And there's no reforms in this budget to change that. Previous budgets included policies, and this was in the previous administration, policies that would save Medicare hundreds of billions of dollars, while last year's budget, Biden's budget, called for an expansion of Medicare benefits, and I think straining the service for 63 million Americans that depend on the program. So another year gone by, insolvency another year closer. Is your agency examining any meaningful solutions to ensure that we can continue the promise that has been made to individuals relying on Medicare?
And Congressman, in 10 seconds, I'm going to do what I know is going to be impossible. I'm going to respond to that question very quickly. First, I think we can all agree that if we're going to look to reform Medicare to keep it going strong forever, we should be cutting costs, not benefits. And if we can all agree to that, we're going to make some progress. Secondly, this budget actually does increase the strength of Medicare. Even the actuaries say that. It does that by increasing program integrity.
Just one quick question. I mean, don't you think we should be talking about solvency and putting forth good
Absolutely.
proposals to increase the solvency rather than adding new benefits at this time?
Well, if you don't want to cut benefits, then we're in the ballgame to talk. But if you start talking about cutting benefits to try to move when we know there's still waste and fraud in there, then that's a non-starter. But we're going to move towards value care versus volume of care, and we're going to work with you closely because, as you know, and I say this having served in this chamber for 24 years, the real people who can make sure Medicare is there in the long run for our grandkids are you all, not us, because you have the votes to change the laws.
Gentlemen,
we'll work with you.
Gentlemen's time has expired. I now recognize the gentlewoman from Virginia, Ms. Wexton, for 5 minutes.
Thank you, Mr. Chairman. Now, I wasn't in here earlier, Mr. Secretary, but I understand that someone on the other side of the aisle made some rather hurtful and hateful and ignorant comments about transgender kids. And I know that a lot of our friends across the aisle may think that that's good politics, but to me, at the end of the day, all they're doing is bullying defenseless children. And where I come from, that is not good politics. Now, I don't understand how any adult, especially a member of Congress, can say these things when they understand what a big problem youth suicides are in the LGBTQ community. And in case they don't know what a big problem that is, I have some statistics because according to the Trevor Project, 46% of LGBTQ youth seriously considered attempting suicide in the past year, including more than half of transgender and non-binary youth. Does that sound like statistics that you're familiar with, Mr. Secretary?
That's what we're hearing.
Okay, thank you. And if you don't trust the Trevor Project, how about these statistics from the American Academy of Pediatrics? More than half of transgender male teens who participated in the survey reported attempting suicide in their lifetime, while 30% of transgender female teens said that they attempted suicide. Among non-binary youth, 42% of respondents stated that they had attempted suicide at some point in their lives. Is that consistent with what you're hearing?
That's what we're hearing.
Right. So it's just really shocking to me that our colleagues across the aisle think that picking on this group of kids who are among the most vulnerable on the planet, really, think that that's good politics. Because to me, it's not. I think that these kids need to be supported. How about you, Mr. Secretary?
And if I could just add, I mean, they're children. I don't care what you call them or what they look like. They're children. I have 3. I hope you'll respect my 3 daughters as much as I will respect your children or anyone else's. It makes no difference what they call themselves or what they want to do. They have a life. We should respect it and stay out of their business.
Thank you, Mr. Secretary. And just because y'all don't understand it doesn't mean it's not real, doesn't mean it's not valid, and doesn't mean that it should be vilified. Certainly doesn't mean that. So I hope that you won't do that. And to all the transgender kids across the country, please know that you do have supporters here in Congress.
Amen.
And Mr. Chairman, I do appreciate your indulgence on this, because this is so horrifying for me, what is happening with our friends across the aisle. And I do hope that they'll reconsider, because this is a vulnerable population, and they certainly need our support, not our vilification. Thank you, Mr. Chairman. With that, I'll yield back.
Gentlewoman yields back. Now recognize the gentleman from Virginia, Mr. Good, for 5 minutes.
Well, thank you, Mr. Chairman, and I don't know to whom the previous comments were directed, but it will change the start of my remarks at least. I think it's demonstrated that those transgender youth, or those gender-confused youth, that when we come alongside them and encourage that confusion, or reinforce that confusion, or deceive their parents about that confusion, we solidify the emotional strains, the psychological strain, and the problems that happen as a result of that. Why don't we follow the God-created science of 2 genders? Why don't we help a child who is confused about their gender work through that? Study after study shows that most of them will find their way back appropriately if we just support them in the right way in that confusion, instead of trying to help them to be more confused about how God created them. God makes no mistakes. And it's really a travesty that we would try to politicize children in this way, and that we would have school systems come alongside and support these children in their confusion and deceive the parents about that confusion. And we would also have entertainment companies, politicians, and all the rest try to do that, instead of teaching the children the truth. Instead of teaching them the truth and teaching them the God-created design of 2 genders, which we all know to be true, we get into instead harming these children by supporting them in this confusion in a negative way, quite frankly. Mr. Secretary, who do you think, changing gears, should be permitted to illegally enter our country? Who do you think should be permitted to illegally enter our country?
Well, you're talking about violating the law if you're saying it's illegal. Why would we permit anyone to violate the law?
I agree with that. We're certainly doing that to the tune of $2 million last year. We're helping those illegally enter our country to the tune of $2.2 million last year. So you don't think anyone should be allowed to enter our country illegally?
Well, you've mischaracterized what's happening, because we have laws, and so long
it would be great if we would actually enforce and follow the laws that we have. That is correct. Do you think anyone should be turned away who tries to enter our country illegally?
Anyone who doesn't have the authorization to be in this country does not have the right to stay.
If you had your way, how many illegals would you allow into our country?
Again, there are migrants.
Do you think there should be some limits to that? What is the end game? How should it be, or should it be at all limited?
May I respond?
This budget, the president's budget, the fiscal year budget, the 23 budget he's proposed, includes a $150 million cut for immigration customs enforcement, provides $4 billion, however, to reward Central American countries that are flooding the U.S. with illegal immigrants. However, contains zero accounting for the amount of taxpayer dollars that are being spent on flights to transport illegal aliens from the border to the interior of the country, making every town a border town, every state a border state. My home community of Lynchburg, Virginia, we just had an illegal alien convicted of murder, MS-13 gang member who was permitted in this country illegally, making even my community in Lynchburg, Virginia, a border town, a border community. This budget also contains zero accounting for the amount of taxpayer dollars that are spent on housing for these illegal aliens, on top of the already $2 billion that was diverted from the American Rescue Plan to the border for COVID-19 testing, vaccines, therapeutics, and so forth for non-Americans. The president's plan to further reduce border funding for our agencies will require HHS to help in a greater capacity to process these illegals into the country, not to prevent, but to help process them, facilitate them into the interior of our country. Do you think the administration is prepared to effectively vet the surge of illegal aliens that will result from this reduced enforcement funding in addition to the termination of Title 42? Are we ready for the surge?
Do you wish me to respond to the question?
Go ahead.
We are doing everything we can to make sure that we deal with any migrant child who's unaccompanied that comes into our custody from DHS.
We're prepared to go from 7,000 a day to 18,000 a day.
We have a legal
I know those are not all UACs or not all children, but
we have a legal obligation to make sure that any child who is unaccompanied does not stay in DHS detention.
so all of our efforts would be to get them through, to get them in the interior of the country instead of trying to prevent this from happening. Does the president's budget seek to combat the fentanyl that's pouring across the border at all? Because with this reduced funding on the border enforcement piece of it, he said in the State of the Union that he wants to fight the opioid epidemic. We're having it come across in record numbers, killing a record number of Americans. Is there anything in the budget that's going to help enforce or combat the fentanyl that's pouring across the southern border?
I hope you're not implying that our Border Patrol and Customs Enforcement agents aren't doing their job at the border.
I am absolutely declaring that we are not letting Border Patrol do their job. Absolutely, we're not letting Border Patrol do their job. Absolutely.
Gentleman's time has expired. You may respond if you want.
I disagree with them. They're working hours long in trying to do their work. It's unfair to criticize them for the work that they're doing and say that they're not doing enough.
I now recognize the gentlewoman from California, Ms. Chu, for 5 minutes.
Well, first, I just have to make a statement in response to what was said earlier. Yes, God makes no mistakes, and that means that transgender kids are not a mistake and deserve our support to be who they are. Well, turning to a different subject, what I came to ask about, which was, Secretary Becerra, wonderful to have you here today. I wanted to ask about reproductive choice. And first, I'd like to thank you for working with the president to once again deliver a budget request free from the harmful and discriminatory Hyde Amendment. Instead, this budget rightly includes significant funding increases for the Title X Family Planning Program and the Teen Pregnancy Prevention Program, both of which help our most vulnerable access the reproductive health care that they need. So I wanted to ask about the Medicaid free choice of provider requirement. We have a disturbing trend in recent years where extreme Republican governors and state legislators have taken action to deny Medicaid patients their legal right to seek services from the providers of their choice. States such as Missouri, Arkansas, Mississippi, Louisiana, and South Carolina have instituted bans of state Medicaid funds going to all eligible family planning providers. Courts have even issued injunctions in several states to stop such bans. Can you discuss HHS's plan to enforce the Medicaid free choice of provider requirement so that everyone can access services like contraception, STI testing, and reproductive counseling at the provider of their choice?
Absolutely, Congresswoman. Please make sure you say hello to everybody back home that I don't get to see much these days. We have to, as I always say, it's our job to comply with the law and enforce the law. One of the laws that we have in the books is that if we're offering family planning services, it's available to anyone who's qualified to offer family planning services. And that means people who are the beneficiaries, the individuals who need those family planning services should have access to those programs. We should not be restricting them because we don't like what else they might do beyond that family planning service. And so we're going to simply enforce the law, make sure that we're in compliance with the law, and make sure, as you've said, and thank you for the work that you've done on this, to make sure Americans have a choice of going to a provider that can provide them with that family planning service.
Thank you for that. And I want to say that one of the benefits of the Affordable Care Act's birth control benefit was that everyone could access the contraceptive method of their choice cost-free. However, this promise has unfortunately not been realized for many, even those who have insurance. Some health insurance companies are still imposing out-of-pocket costs on birth control, which is in direct violation of the law. When they don't comply with the law, the impact is greatest on people for whom even a small copay for birth control is too great a barrier between them and the care that they need. And that's why I was proud to join Representative Lois Frankel in sending you a letter requesting that your agency, along with Treasury and the Department of Labor, enhance your enforcement actions and improve public awareness around the ACA's contraceptive requirement. Secretary Becerra, I know you have experience with this from your time as our state's Attorney General. Can you discuss how HHS plans to ensure insurance companies are complying with the law and that the public is aware of their rights under the ACA? Will patients be the ones responsible for reporting violations, or will HHS proactively be investigating plans to ensure compliance?
Congresswoman, we're taking proactive steps to make sure that those providers and those insurers who are out there receiving federal support for their work understand their obligations under the law to make sure that services that are provided for under law under the Affordable Care Act are made available to anyone who qualifies, and that of course includes women and contraceptive services. So we're going to double down on this to make sure that we both inform providers of their responsibility and make sure that we hunt down those who are violating the rights of Americans to access the services they're entitled to under law.
And let me thank you for your leadership in ensuring Title X family planning program. This is the nation's only program dedicated to providing family planning services for people with low incomes, but has been underfunded for a decade. The budget finally invests $400 million for this program, which is the highest funding in the history of this program. So I wanted to make sure that everybody knew that that is in this budget, and it is a great thing for the women of this country. Thank you.
Thank you.
Gentlewoman's time has expired. I now recognize the gentleman from Iowa, Mr. Feenstra, for 5 minutes.
Thank you. Thank you, Chairman Yarmouth and Ranking Member Smith. Secretary Becerra, thank you for being here. I appreciate your comments. I'm looking at this and thinking what twisted webs we weave. The FY22 Omnibus Bill just passed with Democrats in control of the House and the Senate and the White House. Every chamber passed the current budget. President signed it into law. And the Hyde Amendment, which bans federal funding of abortion, was in it. And yet, can you confirm that to include the Hyde Amendment for FY22 funding bill, your budget does not? I'm wondering why that is.
It is not, because the president has made it very clear that he wants to make sure that we are providing under the law all of the services that Americans should be entitled to.
But he signed the bill. The Democrats approved the bill. I'm missing something here. I mean, you have Democrats control the House, the Senate, and the presidency. He signed it, and yet now he's not doing that? I'm missing this.
What he signed was the current fiscal year budget.
So it was good then, but not now. Is that what you're saying?
Are you suggesting that we shut down government?
No, I'm just simply suggesting I want to know why is this happening? I mean,
if he didn't sign it, we would have had to shut down government. And so are you suggesting?
No, he is. I'm saying he has signed. He signed a bill that the Hyde Amendment was in it, and now you're saying we don't want it anymore.
Are you saying he had a choice? Could he have extracted the Hyde Amendment?
I'm saying that everybody agreed to it, so you'd assume.
Well, I don't think everyone agreed to it, but certainly it had to be included in order to get that omnibus to the president's desk.
Right.
I mean, Congressman, I don't know how long you've been around.
I'd like to clarify one other point here. Thank you. Last week, the OMB Director Young testified to the committee that the budget assumes that even given insolvency, that Medicare spending would continue at its current rates. I also asked the director to clarify how, according to page 5 of the Department of Treasury's Green Book, the budget can work when it assumes the Congress passed Build Back Better last year. It assumed that, which we didn't, right? But it's the book is assuming that. Those two assumptions make absolutely no sense to me. Assuming Build Back Better was passed, it also assumes that Medicare will go bankrupt, insolvent earlier. On the reverse, expanding Medicare under the assumed Build Back Better law, which they say is in here, would drastically change Medicare spending. So Medicare spending accounts for 15% of all our spending, and it's going up dramatically. So my question is, Mr. Secretary, why doesn't the budget address this? Medicare is on track to be insolvent by 2026.
Congressman, if you read the budget, you'll see that the president's budget request does provide further support to strengthen Medicare.
Oh, yeah, I agree, but it also, in the same budget, creates Build Back Better. So then it dramatically expands Medicare.
More services to seniors is a pretty good thing. And
I'm not arguing that. I'm simply saying, based on the budget, that you're dramatically expanding Medicare under the Build Back Better, which is in the budget. It's assuming on page 5. And yet, I just heard you talk to Congressman Smucker, and you're saying, you know what, we'll be okay. That's not what the budget says.
If you read the budget, you
I read it very
realize that
closely.
it reduces the deficits in the long term. It actually provides for a very fiscally responsible
But
way.
not the unfunded liability of Medicare.
Congressman, there are provisions in the president's budget that extend the fiscal strength of Medicare. There are provisions in there that would provide for further program integrity. And as I
agree
mentioned
with
earlier,
that.
and as I mentioned earlier, I believe this administration is prepared to speak to anybody who wants to talk about strengthening Medicare by cutting costs, not by cutting benefits.
Okay, thank you. Thank you for that. But I don't need any more comments, but I just want to say this. When you add Build Back Better and all that you're doing for Medicare, all the extra pieces, Medicare is going to go insolvent a lot faster. It will. And you don't have to.
You're saying we should not improve Medicare for seniors?
I'm simply saying to you is your budget does one thing. It's sort of a shell game, right? It's a shell game saying, hey, we're going to do this dangling thing over here, but don't look over here. What's going to happen in 10 years?
No, the president's budget reduces the deficit. It does so because it's fiscally responsible. At the same time, the president clearly wants to make sure we improve Medicare services and benefits.
Short term, it does, but I'm looking 10 years out, and that's what the budget does. Thank you. I yield back.
Gentleman yields back. Now recognize the gentlewoman from California, Ms. Lee, for 5 minutes.
Thank you, Mr. Chairman. Hello again, Mr. Secretary. Nice to see you. Let me just clarify one thing with regard to the Hyde Amendment. The Hyde Amendment was passed. I was a staff person here for the Honorable late Congressman Ron Dellums when Henry Hyde inserted the Hyde Amendment in the mid-'70s. That amendment was to deny the full range of reproductive health care, including abortions, to low-income women and women of color. Thank goodness our bill did not include that after all of these years when we sent that to the Senate. And so the Senate, unfortunately, held it up, and the government could have shut down if it hadn't been for the negotiations. And so who sacrificed for making sure that the government would not shut down? It was low-income women and women of color. And we're going to continue until we provide equity, racial justice for everyone, every person in this country, and that includes Black and brown women and low-income women. And so, Mr. Secretary, I just want to make sure that's clarified, that the government could have shut down, and I'm glad that you signed the omnibus bill, but we're going to keep fighting until justice is done. So thank you very much. Let me ask you about HIV and AIDS. During the Labor Age Appropriation Subcommittee hearing last Thursday, you mentioned that the budget for the new $9.8 billion mandatory spending PrEP delivery program largely focuses on bulk purchasing of generic drugs. So let me ask you, with regard to the administration, why has it designated the funding as mandatory rather than discretionary? And have you connected with the stakeholders? And also, is there a consensus on how the $2.8 billion will be distributed? With the availability of low-cost generic and free drug programs for people who are uninsured, I'm hearing from the HIV community that access to the drug is not the issue. What I've heard is that clinics need funding to cover lab services and medical visits for the uninsured. There's also a need for community outreach programs and provider education and training programs and other wraparound services. And so can we ensure that the new PrEP program focuses on these support services also? And how is this going to be structured, given that it's right now not discretionary?
Congressman, I think, as always, this is the president's proposal. I suspect that you and your colleagues will try to work this budget to make it something that works as best possible. We'll be there to support. What we do want to do is make a commitment to make sure that everyone has an opportunity to have the life-saving therapies that are available now to anyone with HIV/AIDS. And we will do everything we can to make it affordable for everyone in America. And so we're more than willing to work with you. If you think there's some better ways of doing it, we are certainly willing to listen. This is the president's budget proposal. At the end of the day, as you just finished your discussion in terms of the omnibus, you all will determine what the budget looks like. But we hope what it will do is make a major investment in PrEP and doing all the things that we need to do to really tackle HIV/AIDS.
Thank you very much, and we'll work with you on that because I think we have some ideas about a better way to do this. Also, the National Academy of Sciences, Engineering, and Medicine issued a report recently on primary care that estimates 85 deaths per day in the United States are the result of declining access to primary care. Your budget proposes a $5 million increase for training in primary care medicine, thank goodness. Is the proposed investment in primary care part of a larger strategy to address the growing shortage of primary care? And also, we're working with an initiative that the National Academy put forth in recommending some pathways and strategies for Black medical physicians and engineers, and the African-American community is lacking in terms of African-American primary physicians.
And Congresswoman, COVID made it even more clear how much of a gap there is in getting professionals, healthcare professionals, into many communities in this country. And so we are absolutely committed in making a difference there. We want to increase the funding that we have for the pipeline of those medical professionals. We want to make sure that they are able to afford getting those medical degrees. And we want to make sure that we provide them. I should give you a real quick example. My son-in-law is about to finish in about 2 months his residency program as a pediatrician. He will be, as a result of a federal program, the Public Health Service Corps program, he is now about to serve for 5 years in a medically underserved area of the country. He was able to do that and go to medical school without having to pay for it because he's made that commitment to serve for 5 years.
Mr. Secretary, you said your son-in-law, Mr. Chairman, we served together in the California legislature, and I remember when your twins were born.
Yeah, that was
so congratulations.
Yeah, so that's where they are now. She's now married, and her husband is finishing his residency program.
My God.
Yeah, I know.
Congratulations to you. So thank you again. We look forward to working with you.
Thank you.
Gentlewoman's time has expired. I now recognize the gentleman from Virginia, Mr. Klein, for 5 minutes.
Thank you, Mr. Chairman. Thank you, Mr. Secretary, for being here again. I got to speak to you last week on the Labor HHS sub, and appreciate you being here. Earlier, you stated that gain-of-function research was not directly or indirectly funded, and that U.S. taxpayer dollars did not go to the Wuhan laboratory. Is that a correct statement?
The National Institute of Health and HHS does not fund I lost it.
Gain of function.
Gain of function, thank you very much. It's a long day. Gain of function research, and certainly not directly to, or even indirectly to Wuhan Institute of Virology.
Okay. I'm looking at a letter from October 20th, 2021, where a top NIH official responded to Ranking Member Comer that EcoHealth Alliance, a nonprofit that has sent U.S. funds to the Wuhan lab, had not been transparent in their work. So apparently there were funds that were sent from NIH to the EcoHealth Alliance and from the EcoHealth Alliance to the Wuhan lab. Would you agree with that?
You're now speaking about Ecolab and some of the funding it may have done with some of its subs. You asked me about direct or indirect funding by NIH, and I've said to you that we do not do direct or indirect funding to the Wuhan lab.
Okay, you wouldn't call that indirect funding?
For the gain-of-function research issues, no. As far as I know, we have not done any direct, we have not contracted with someone to do direct or indirect research on gain-of-function.
What would you call it when money is sent from a government agency to a sub, EcoHealth Alliance, and then directly to Wuhan lab for the purpose of gain-of-function research?
I say, show me what you got. Just let me see what makes you say that.
Well, the letter I have is from your NIH on October 20th. And it states that EcoHealth Alliance did send money to the Wuhan lab.
To do gain-of-function research?
The gain-of-function research was occurring and that was known to NIH, that it was occurring when the grant was asked for.
Read to me, please, where it says that the NIH funded Ecolabs to do gain-of-function research through the indirect funding of Wuhan Institute.
What I'm saying is that the EcoHealth Alliance received money from the
Well, okay, you can confuse a number of things together to try to
federal
reach a
government.
conclusion, but that doesn't mean that we funded gain-of-function research.
If the money from NIH went to Ecolabs and Ecolabs funded the Wuhan lab efforts at gain-of-function research, that is indirect funding.
Congressman, are you asserting that the only funding or the only research that Ecolabs does is with Wuhan and only on gain-of-function research?
Are you insinuating that somehow money is not fungible and that money provided from the federal government doesn't somehow support efforts to do something that an entity could be engaged in at the same time?
I'm trying to answer your question. Your question was, does the federal government, does HHS, or does NIH fund gain-of-function research to the Wuhan lab of research that the Wuhan Institute of Virology does? And I said to you, no.
Well, money is fungible, as you well know, and I would argue to the contrary. And so if you don't wish to amend or clarify your statement, I'll just...
I think it's clear, Congressman.
I think it's intentionally evasive on the part of you and on the part of NIH to avoid taking responsibility for funding gain-of-function research.
Congressman, I don't want to be evasive. I just want to respond to your question as you posed it. If you want me to answer the question about whether Ecolab may do any other types of research or fund others, that might be a different question. But you're asking if we, the federal government, are funding the Wuhan Institute of Virology to do gain-of-function research, and the answer is no.
Well, Ecolabs knows that they funded it. NIH knows that Ecolabs funded it. You know that they funded it. The American people know that they funded it, and I'm disappointed in the evasion today. I yield back.
Does the gentleman have any interest in submitting documentation for the record?
Mr. Chairman, I'm happy to submit the letter from Ecolab to NIH for the record.
Okay, without objection. Gentleman's time has expired. Now recognize the gentleman from Pennsylvania, Mr. Boyle, for 5 minutes.
Thank you, Mr. Chairman, and it's wonderful to see literally the first person who welcomed me after my election 8 years ago back. Mr. Secretary, thanks for being with us. And I want to focus on something that actually I have not heard for quite a while, at least in this hearing, and something I fear we're not focusing on the way we should be in Congress or even in society, and that is our twin challenges of substance abuse problems as well as the mental health crisis. You might recall about 4 or 5 years ago, actually, the substance abuse issue, the closely related overdose issue got a lot of attention, which was a good thing. But it is then, partly, I suspect, because of the pandemic, but partly because the media has a short attention span. Unfortunately, this subject has kind of receded in the public's attention, which is completely contrary to where we actually are in both of these twin crises. For example, and this is according to the CDC, in a 12-month period ending in April 2021, we had an increase of 28.5% over the exact same period the year before in terms of drug overdoses. Now over 100,000 a year for the first time in American history. And then with respect to the mental health crisis, just anecdotally, won't even cite statistics, the number of people in my own life, close to me, who have now suffered with this, the number of friends I have who have a loved one who has suffered, it is not overstating the situation to call it a crisis. So I was really impressed with your testimony. I was so glad that you focused on both of these issues in your written testimony. Also, the commitment to invest more than $100 billion over 10 years to transform the mental health as well as substance abuse disorder coverage system in the country. And I was hoping, I wanted to give you the opportunity to talk a little bit about beyond the dollars and cents, what exactly that means.
Congressman, thank you for that. One of the things it means is trying to finally remove the stigma. If you are right now caught in this trap of substance use disorder, it is tough to get out. I mean, just the addiction is tough, but facing the stigma that's attached to it is sometimes very difficult for folks to overcome. We don't want to blame you for having become addicted to this disease. We want to help you get out of it. And so one of the things we're doing is we're trying to turn towards the evidence to tell us how to go about doing substance use services. And so we changed the strategy altogether. We're now focusing not just on preventing people from getting addicted, and not only treating, but now to following them through the process so they actually succeed long term. Yeah. And even before that, trying to help them not harm themselves. It's, we want to save a life, but we also want to keep you from harming yourself along the way. And so our strategy is far different. And I hope what we do is prove that we want to be there for you in the long run.
Well, I'm happy to hear that with respect to substance abuse. And just briefly on the mental health side of it, I would bring to your attention, though I'm certain that you are aware of it, that although this is the case actually with both, it's not just the person who is suffering either from an addiction or from a mental health issue, but the family that is affected. Sometimes, especially with respect to mental health, sometimes it's actually the family that is suffering even more acutely. And so anything we can do to provide resources to the families, there are just far too few in our society, and we have a lot of people in our country who are hurting because of that.
Congressman, there's where the home and community-based services that we're going to try to really beef up so that people can receive care as close to their loved ones as possible becomes so important. And so to the degree that we can support someone, whether it's because of mental illness or because of substance use disorder, get the treatment they need, the services they need, as close to home as possible, the better off we'll be.
Well, and finally, just in the 30 seconds remaining, and I don't have a silver bullet on this, I don't think anyone does, but what many have found, my family included, is that if you have a loved one who has a mental health issue, but the loved one doesn't recognize the very serious issue, there are far too few options for the family. And of course, we're a country that believes in civil liberties, that's right, but there has to be a better way of balancing civil liberties with the desire of a family to get love and care to one that desperately needs it.
Amen.
Thank you. I yield back.
Gentleman's time has expired. I now recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you for being here, Mr. Secretary. I got a quick question for you to begin with. It's about the Medicare Area Wage Index. I'm sure you're familiar with that. And it's hurting hospitals in my district. Now, I represent South Georgia. Keep in mind, there are 2 Georgias. There's Atlanta and everywhere else. And I'm talking about everywhere else, okay? And I'm talking about a very rural area. And it is really hurting our hospitals. And I've got legislation. It is H.R. 4066, the Save Rural Hospitals Act, and it establishes an area wage adjustment floor for Medicare hospital payments. I just want to ask you if you'll commit to working with us to get this fixed so that we can help rural hospitals. You're familiar with the plight of rural hospitals. You're familiar with how important they are to these communities. And you know that they're struggling. You know a lot of them are closing down. This will help, and we need your help on this, and I just want to get that commitment from you.
With the number of facilities that are closing down in rural America, it is alarming. Absolutely, you have my commitment to work with you. We may not agree on every solution, but I am absolutely committed to working with you.
Good. I hope you'll look at this legislation. Again, it's H.R. 4066, and it's bipartisan, and it's good legislation that will help us as well.
And if you need any technical assistance on that, please turn to our team, and we'll be there to help.
Thank you. I appreciate that. Mr. Chairman, I'd like to ask unanimous consent to submit this letter from the Tennessee Hospital Association and signed by 9 other states, including the state of Georgia, regarding the Medicare Hospital Area Wage Index.
Without objection.
Thank you. Now, Mr. Secretary, I want to ask you about, I actually sent you a letter. I led a letter about this and had 53 signatures of my colleagues on it. It has to do with the president's fiscal year 2023 budget. And once again, it promotes taxpayers' funding of abortions by excluding the long-standing bipartisan Hyde Amendment protections that prohibit the use of taxpayer dollars to subsidize abortion services. Are you aware of that?
Congressman, I'm fully aware of this issue and the deeply held beliefs that really reside behind it.
Thank you. I wanted the letter that I sent you and that was signed, as I say, by 53 of my colleagues. It mentioned in there our concerns about the task force on reproductive health. And you're familiar with that? I believe that's something that was implemented, instigated by your office.
It absolutely was.
Okay, well, you know, that was on the 49th anniversary, I believe, of Roe versus Wade, where you announced that you'd be forming this task force with the explicit purpose, as I understand it, of promoting abortion in response to pro-life laws passed by states and increase abortions in foreign countries?
Congressman, I have long supported reproductive decisions in privacy under Roe v. Wade.
Okay, but what about the Hyde Amendment? And what I'm getting at here, 73% of Americans oppose using their tax dollars to pay for abortions in other countries. 73%. And just recently, in January, a majority of Americans opposed taxpayer funding for any abortions here in America as well. So we're talking about taxpayers' dollars here being used for something that they're opposed to, and that is for taking the life of the unborn. And that's from my perspective. The task force that, as I understand it, it formalizes the pro-abortion advocacy at home and abroad that it's already been promoted through HHS. Does this new task force intend to use federal funds to advocate against state laws to protect the unborn?
The purpose of the task force is to make sure that we are enforcing the laws that are in place and protecting people's rights under those laws.
Including the Hyde Amendment?
It would any law that's in place, we would
Including the Hyde, that's easy, yes or no? Including the Hyde Amendment?
we will enforce and protect the rights of people under all our existing laws.
Including the Hyde Amendment, yes.
We will.
Yeah, okay. I'm a pharmacist. I'm not a lawyer, so you can use your lawyer talk with me. But
I'm being pretty clear. We're going to enforce every
pretty
law.
clear, and that includes the Hyde Amendment, which protects the unborn and prohibits the use of taxpayers' money for abortion.
As I said, we're going to protect every person's rights under existing law. I'm not excluding any particular laws. I'm just going to make sure I enforce the laws properly. I am obligated to comply with the law. And so if there's a law in place, I'm going to comply with it.
Good. And that shows us and tells me how important it is that we make sure that the Hyde Amendment rules are added into any budget and into any laws, any appropriations that we have. So thank you, Mr. Secretary, for being here. Appreciate your indulgence, and I yield back.
Thank you for your questions.
Gentleman yields back. I now recognize the gentleman from New York, Mr. Jeffries, for 5 minutes.
Thank you very much. Good evening, Mr. Chairman. Good evening to our very distinguished witness. Good to see you. I've had the opportunity to call you Chairman Becerra, General Becerra, and now Secretary Becerra. I appreciate your distinguished record of service, and of course, welcome back to the House of Representatives. When President Biden came into office in early 2021, I believe about only 2.8 million Americans were fully vaccinated against COVID at the time. Is that correct?
Less than 1%, that's correct.
And about 15 months later, how many Americans are fully vaccinated?
Over 217 million.
It's an extraordinary accomplishment. Does that happen by accident, or how did that actually occur?
It is neither accident or coincidence. It was a lot of hard work on the part of many of the people at HHS and throughout government, and a lot of the folks out there in the private sector and in local government as well.
None of my colleagues on the other side of the aisle supported the American Rescue Plan. How instrumental was the American Rescue Plan in helping to stand up a public health infrastructure with respect to both the vaccination accomplishments that you and others within the Biden administration are responsible for, as well as our general efforts at working through this deadly once-in-a-century pandemic?
Indispensable. Without it, hundreds of millions of Americans wouldn't have the level of protection they have. Hundreds of thousands of healthcare providers, doctors, nurses, hospitals, healthcare clinics would not have been able to receive reimbursement for some of the costs they've incurred to provide those services to Americans to stop COVID.
The American people are understandably fatigued as it relates to this deadly pandemic, and it's been with us now for 2+ years. And we've been through multiple variants, Delta variant, Omicron variant. Now we've got a subvariant, I believe, officially it's referred to, BA2, I believe. But this is still a challenge, and more than 900,000 Americans have been killed by COVID-19. That's an extraordinary amount of people. That's a lot of pain and suffering and death that have been experienced in every community across America, rural, urban, suburban, exurban, small town America, Appalachia. How should we be thinking about this moment that we're in as Congress is contemplating additional funding for the next phase of working through this pandemic?
Don't go AWOL, not at this time, not when we're so close. This is not the time to turn off the burners that let us go ahead and, as one of your colleagues said, Mr. Horsford said, to crush COVID. This is our chance to crush COVID. This is the wrong time to not provide the resources to crush COVID.
I agree. And in terms of the possibility, or at least the recommendation that I believe has now been publicly made in terms of perhaps the importance of an additional vaccination shot, certainly for people who've got pre-existing conditions that may cause a COVID infection to be far more deadly, and certain age groups, I believe now north of 50. Does the administration currently have the resources necessary to ensure, as has been done up until this point, that vaccinations are available for every American who chooses, who has the freedom of choice and exercises that freedom to get vaccinated?
We have fortunately made investments that allow us to have vaccines that we need for what we know we must do. But if we get to the point, for example, of requiring doses for the fall, another boost in the fall, we probably would not have the resources to provide that to all Americans if indeed FDA says it's appropriate to provide that to those, and CDC, I say it's appropriate to provide those all adults 18 and over, or perhaps even children as well. We would not have the therapeutic medicines that we need if we have another surge in the fall. We are running out of those resources. We did a lot of planning, so we have vaccines in place for those who need them today, but we don't have the resources, and therapeutics as well, and some of the testing, but that's going to quickly dwindle. And remember, we're at the front of the line in getting these vaccines, these therapeutics, because we made the investments early in big numbers. We don't do that, we go to the back of the line.
And lastly, how important do you think making the investments in terms of the availability of therapeutics will be for us to get to a point where we can return to some semblance of new normal as we emerge from the current phases of the pandemic?
It's critical. It's the all the above approach, because certainly the vaccine are the best way to deal with this, because if you can prevent the contraction of COVID, that's the best thing. But if someone does get it, to keep them from going to the hospital or perhaps dying, the therapeutics are very important. And so all of that, along with the testing, along with the masks, along with the things that keep us safe, are critical to crush COVID.
Thank you, Mr. Chairman. And thank you, Mr. Secretary, for your testimony and for your service.
Thank you to you.
The gentleman's time has expired. I now recognize the gentlewoman from Texas, Ms. Jackson Lee, for 5 minutes.
Thank you very much, Mr. Chairman, and thank you, Mr. Secretary. It's a pleasure to be in the room with you. And let me acknowledge that America has a great deal to be thankful for this administration and under your leadership. You were an early appointee, and we're delighted that people are living because we took hold of the reins and had a no-nonsense plan to ensure all Americans, and I want to emphasize in particular, impoverished and uninsured Americans as well. In the state of Texas, we are literally the poster child for uninsured. We're the poster child for the poor handling of COVID in the early stages. We have upwards of some 90,000 cases and maybe 50,000 dead. And we continue to have the issue of low vaccination rates in different portions of our state. We somewhat fell victim to no masks, fights about masks, and other destructive elements that certainly were not positive. So I want to just go right to the heart. The administration put forward a very positive and effective COVID package that would include impoverished being able to be covered or the uninsured, as well as to make sure that there would be dollars for those who may be coming in petitioning for asylum, and making sure that those individuals might be vaccinated. In addition, we were very much concerned about the international aspect of a very small world. Can you tell me what medical health impact a skinny COVID has? We certainly want to move forward on a COVID bill, but what do we leave out and what danger do we face?
Congresswoman, we disclose how we utilize the resources we get. What it simply means is that we will be back sooner than you think, saying we're here again, we're depleted in our resources, and we need to finish the job. And so I will simply say to you that we're going to use whatever resources you give us the best we can to keep COVID at bay. And I hope that we don't let our guard down and have some future variant come back and just squeeze us the way it did back in 2020.
One of the issues that we all face is mental health and substance disorder. You have put a sizable amount in the president's budget or in your budget. Tell me what you're doing agency-wide to ensure the parity between physical and mental health. My colleague just spoke about the dangers, the damages. I would add that one of the most dangerous calls are domestic violence calls for police officers, but in the mix of that is someone having a mental health crisis.
So, Congressman, I don't think there's any other way to say it, but that the president's budget is a game changer. It takes mental health services and the approach to tackling mental health conditions to a different level. When you are willing to commit not only discretionary but mandatory dollars to the degree the president has, so that we can help states attack the crisis that we see in our communities on mental health. I hope what Congress will do is accept the challenge and help us, because there are people crying out today for help. We're getting ready to launch the 988 three-digit code that will be available for people to call, similar to 911. The 988 will be for those who are suffering severe mental stress and who are on the verge of doing something that they will regret. We want to make sure that when that system goes live nationwide, that if someone is going to take the time to make the decision to call us instead of going the wrong decision, that they get an answer, not be put on hold or get a busy signal.
And let me just quickly indicate, I would hope, as you well know, we have those community public health clinics around America. I'd like to see us dedicate some totally to mental health services. And I hope as we continue, we'll have an opportunity to discuss that. Let me just quickly say, let me thank you for the emphasis on child care, Head Start, the block grants, and you might comment on how important that is coming out of the pandemic. As I do that, let me ask unanimous consent to put into the record an article dealing with White House Burdens Initiative to address long-term COVID-19, and then an article about UMC, a hospital in Houston.
Without objection.
Thank you. I would like to raise the UMC hospital and just ask that I get a report back on that issue and to see whether there's any reconsideration. But I'd appreciate your comment on the mental health, and then thank you for what occurred in the CMS settlement that gave us a lifeline until September regarding the Medicaid. I'd like to continue working with you on how we can solve that 1115 problem. But could you just comment very briefly on the child care that you all have invested in here that I congratulate you on? Thank you.
Yeah, and I'll be brief because I know time has expired. I'll simply say this, Congresswoman. I remember the days when the talk was every parent should, if you're going to have a child, start thinking about how you're going to invest now for your child's college education. So start putting away money now so you can afford the tuition of your child. Well, today, Americans are being told not only to save for that college tuition for your child, but be ready, because by the age of 1 or 2, whenever you start childcare, you're essentially spending college tuition level amounts to get basic childcare for your 2 or 3-year-old. That's incredibly difficult for any family that's middle class or below. We need to do something to make childcare affordable. We have a very productive workforce. We don't want people leaving the workforce because they can't find quality childcare. We also have to treat those people who work in childcare as human beings, as professionals, pay them the salary so they don't go off and decide to go flip burgers because they can get more money doing that.
Chairman, thank you.
Gentlewoman's time has expired. I now yield myself 10 minutes. I promise I will not take anywhere near that time. We'll have no problem getting you out of here well before your hard stop, and we appreciate your patience and responsiveness. There are just a couple things I want to address. One is my colleague here, the ranking member, talks a lot about the American Rescue Plan and his figure, which I will accept as accurate, that even though I don't know what criteria he established, that only 9% of the $1.9 trillion was spent directly on COVID, combating COVID. But the name of the bill was not the American COVID treatment bill or COVID prevention bill. It was the American Rescue Plan. And it was named that because we understood that there was a terrible cost enacted, or a terrible cost that was experienced at every level of our economy and our society, that families were impacted negatively, that businesses were impacted negatively, that local and state governments were impacted negatively, and that without the federal government stepping in, that there's going to be real damage done at the human level and at the economic level. So we allocated a great deal of money to state and local governments, and because in prior relief packages we had set very strict criteria that resulted in, I think, virtually every one of us getting complaints from our mayors and county executives and governors that we put too many restrictions on that money and we need to give them more flexibility. So we did that. I fully admit that I think the ranking member is right. Some of the projects that have been funded, some of the uses that some localities have made of the funds certainly don't comply with the spirit of what we were doing. Although they would make the argument that their budgets were impacted generally, and these were things that, as one of our Republican colleagues said, money's fungible sometimes, and with state and local budgets it can be. But we also gave hundreds of billions of dollars, allocated hundreds of billions of dollars to schools so that they could make the return to school safer and smoother and for the students, and that there would be money available to do remedial education for students who had lost ground when they were out of the classroom for such a long period of time. So, yeah, I think it's really not fair to say that the American Rescue Plan wasn't actually all related to COVID, because it was the impact of COVID and not just the disease itself. Just wanted to make that point. And then the one thing I want to ask you is, because my Republican colleagues, again, talked about immigration a lot during this hearing, and you and I have a common experience with immigration policy in this Congress. We spent 6 or 7 months in 2013 every afternoon trying to write a comprehensive immigration reform bill. And as a matter of fact, we did. And we had 8 members, 4 Republicans, 4 Democrats, and final analysis, 7 of us signed off on it at the time. And the Senate had already passed a comprehensive immigration reform bill on a bipartisan basis earlier that year in 2013. And the Republican leadership of the House at that point was unable to take our proposal, or unwilling to take our proposal and put it before membership. And even though we were fairly convinced, I think you'd agree, that if our package had gone before the House, that it would have passed, again, on a bipartisan basis. The only question I have of you, looking back to that time, is all of the problems we face in immigration right now, not all of them, but how do you think the current immigration situation would be if we had been able to pass that bipartisan proposal in 2013.
It would not be. We would not be facing these circumstances had we passed that law. Because as you recall, Mr. Chairman, it dealt with all components. It provided border enforcement in ways that were aggressive and smart. It provided for the needs of our industries and our communities when it came to how we would bring in immigrants into the future. And it provided for a rational way to deal with those who had been in this country for years, like the Dreamers, and a way to rationalize how to address them. Some would get to stay, others would not. And I think if we had passed that law, we would have had a rational approach to the border. And it makes it very difficult when you continue to see a broken immigration system wreak havoc on our policies.
Yeah, and after that experience, and I confess I came into that process as way behind the curve on my understanding of immigration law. I don't still know why I was part of that group. I think I was put there to be the answer to which one of these doesn't belong. But I do joke that, no, actually Kentucky was a border state in the Civil War, so that's how I got there. But one of the things that occurred to me, and I think you just said it essentially, is that this is not an optional exercise for this country to do a comprehensive immigration reform. It's mandatory. And the fact that we're not pursuing that aggressively is tragic and is exactly the reason that the problems we're facing now exist.
And if, Chairman, if you'd allow me, the fact that we're going through this situation at the border because we don't have a system that lets us process individuals who make a claim for asylum in the appropriate way, it doesn't work. And when it doesn't work, we're sending very mixed messages around the world. And we need to make it work because everyone looks at the U.S. as a place where things work.
I appreciate that input. And before we say goodbye to you, I just want to invite you, if the documentation that Mr. Klein has submitted comes, if you would like to view that, whatever documentation, and respond for the record, that would be great.
Appreciate that, Chairman.
Okay. And with that, I will yield back the balance of my time. And if there's no further business before the committee, I thank you again for your testimony and your service, and this hearing is adjourned.